A very good morning to all dignitaries, Honorable Chairman Sri T. Jepal Reddy, Principal Dr. P. Rashikar, Dr. Pravin, Head of the Department, delegates, and today's Speaker of the Session 1, Professor Dr. P. K. Lakshmi, Head of the Department of Pharmacy Practice, G. Pullareddy College of Pharmacy, Hyderabad. Myself, Dr. G. Dharani, on behalf of St. Peter's Institute of Pharmaceutical Sciences, is delighted to welcome you all for this webinar on Overview of Pharmaceutical Care Concepts and Medication Errors, organized by the Department of Pharmacy Practice in association with IPA Hanmakonda Local Branch and ISPAR India Telangana Chapter. I would like to thank all the delegates for the overwhelming response for the registration for today's webinar. We have crossed 1800 registration from various colleges all over India. Now I request our principal Dr. P. Rashikar to deliver the welcome address.
Good morning, everyone. Hope everyone is doing well. And this is the best way of putting ourselves in the pandemic to make sure that the education is continued. And also, we have a wonderful stalwarts coming into all this webinar series from various places in and around India, as well as we have it from abroad as well. And today we have an excellent speaker, Professor Lakshmi Garu, and we know her priorly. Also, we have several times we have been touch with her with respect to various online classes that she has delivered. And we welcome her today, and also the delegates. So today have crossed more than 1800. They are almost close to 2000, we can say. And also they are from various colleges, more than 50 colleges in and around India, and also a few delegates are from abroad as well. And also, I welcome all the delegates on behalf of St. Peter's Institute of Pharmaceutical Sciences, and also thank all the organizers for making this happen. And also, I thank my management for providing this opportunity and making this series a continuous process. And also, I wish that this program goes good, and I wish all the speakers to be very thought-provoking and also giving the need of our concept like medication errors and how to handle them. And without much haste, I'll be pushing this session back to Dharani. Thank you, Ananda.
Thank you very much, sir. I would now kindly request the visionary behind St. Peter's Institute of Pharmaceutical Sciences, our chairman, Sri T. Jepal Reddy, sir, to enlighten us with his presidential address.
Very good morning to you all. This is a wonderful day where we are going to talk about the patient care and the importance of the role of the pharmacist, especially the clinical pharmacist who is going to be intervening in the healthcare system, where the ultimate goal for entire healthcare system to provide the best healthcare to any given patient. To let you know, I think as per the 2010 data, uh, I think entire population globally, I think it was mentioned that it was close to 20% of the deaths are happening because of medication errors. It might be a self-medication errors or prescribed medication, or the kind of what you call the mistakes happening from a doctor or unnoticed from a patient, what you call pharmacist who is delivering the medication to the patient. But once the WHO has recognized this particular issue, I think they are emphasizing a lot because of on the same brand, same technology, same kind of what you call the wordings that are being used, because there are some millions of medications across the globe in their local market or the domestic market, you name it, because error can happen anywhere. But the role of a pharmacist is enormous. Even in my own case, I think a pharmacist has identified 3 times in my life, stating that, sir, why don't you verify this particular medication? The first 3 medications are in the proper suiting to one particular kind of the disease management, but the fourth one is nowhere related to this particular medication that has been written on the first 3 doses. Just imagine. If he has not told, I think I could have gone into something unhealthy kind of adverse drug reaction. I don't know. Something could have happened to me because he told this not at all required. This is going to damage you. And once again, I want to there are only three words at the end he has written wrong. Just imagine. So this is very important. I think this need of the hour. I think every pharmacist, either the teaching pharmacist or the learning pharmacist or the community pharmacist working in the on-site, what we call in the pharmacy stores, community pharmacies, or he's working in the hospital, wherever he is. I think your role, your the final check before giving to the patient, I think you have a bigger role to save the patient. Wherever the countries are utilizing the role of clinical pharmacist as a mandatory, okay, there the reactions and this critical care management and what you call it, the pharmaceutical care has been increased a lot, and the side effects, adverse drug reactions, you name it, anything, non, what you call, not required medications. Okay, I think there's a bigger, I've gone through many studies. I think even in most of the FIPs, this is the biggest story happening every time. I think more than 6 to 7 FIPs that I've been attending, FIP concentrate mostly on the patient care. Okay, so there I'm seeing the role of a clinical pharmacist is something unique. He enter his study for 6 years or in the M.Pharm pharmacy practice or from B.Pharm coming into the patient care system. I think your role is very big. So 20% of the population dying because of medication errors, just it's not a joke. It's a very big crime. I think you are the right people to make it things set right. You have a bigger role to save the patients from their unknowingly they're dying, because you need to be more cautious, more patient, and understanding the patient needs, understanding his diseases, again counter verifying and rechecking, and again what you communicating with the doctors. I think you need to verify and you can't ignore a single word in that prescription. You have every right, even government of India in 2019 has given pharmacists have a right to question the prescription, and doctors need to write everything on the what you call they need to write only generic names. So your role is coming bigger and bigger. You are the people who are going to really educate every patient and talk about the generic drugs. Now the doctors are not allowed to write the brand names, but still it's happening. But a day will come where it is going to be mandatory. So all the clinical pharmacies across the country, dispensing pharmacies, okay, wherever you are, I think you need to be helping the patients. Your role is bigger. Okay, so I really take this opportunity to thank Dr. P.K. Lakshmi Garu. I know her very well. She was a part of in many of the activities that I've been doing from Polarity College of Pharmacy. I really appreciate her for accepting this particular uh, webinar on the overview of pharmaceutical care concepts and medication areas. And I also really appreciate Dr. K. Santosh Arun Kumar from Andhra University. I also know him well. Dr. Avinash D. Kardela from UCA University from Gujarat. I really welcome you, sir. So I really appreciate all the three speakers for taking their time and coming forward. And it's in a big number. People are waiting. All the pharmacies are waiting to listen how to avoid these medication errors. And your insight, your knowledge will really help them when they get into the real-time situations. I appreciate today's convener, Dr. Dharini, for taking a wonderful topic, and also the Department of Pharmacy Practice, Praveen, and entire his team, and Principal Dr. Rasekar for taking initiative. I think this is the 14th webinar for the last 2 months, and all the topics, whatever you are doing, I think really that will educate. Today's advantage is a webinar, and people across the globe are taking and listening and viewing the lectures. And I'm so happy when this is kept in even in the YouTube channels, I think people are reading again and again, viewing again and again. So definitely, it's a blessing from all the speakers. I should really appreciate all the speakers for coming forward and giving your insightful talk and making the young pharmacists to learn much more and more. So I once again wish all the best for all the delegates. This is very much important how to identify these medication errors and making things set right. You are on the driver's seat, you are on the leadership position. Even government of India, I told you in 2019 they gave a clear indication. GEO has come from government of India. It has a gazette. So in days to come, I think as it is being used in some of the countries as a mandatory, your role will be much enormous. So I wish you all the best and have a wonderful learning today. Thank you.
Thank you very much, sir, for your inspiring words. Now, proceeding to our session, I request Dr. Praveen, HOD Pharmacy Practice, to introduce our first speaker of this session, Professor Dr. P.K. Lakshmi, Head of the Department of Pharmacy Practice, G. Pullareddy College of Pharmacy, Hyderabad.
Very good morning, everyone. It feels great to meet you all again for another session. This time we are talking about medication errors, and I feel honored to introduce to you Professor Dr. B.K. Lakshmi, a Professor, Department of Pharmacy Practice, G. Pullareddy College of Pharmacy, Hyderabad. She was an ex-director, Drug Information Center for Karnataka State Pharmacy Council, Bangalore, and an ardent yoga practitioner. She has been trained in clinical pharmacy and drug information at Austin Health, Melbourne, Australia. She has undergone many international trainings by WHO, and she has established several drug information centers across the country, including at the Department of Clinical Pharmacy at Victoria Hospital, Bangalore. And she has guided several students for their PG and PhD dissertations in across pharmacy practice and pharmaceutic streams. She has been a recipient of IDMA's GP Nair Award for the best outgoing student in the year 1990, and she is a proud alumnus of Madras Medical College. And she has published more than 100 articles. I really feel honored to introduce you, ma'am, for today's session. Kindly start the session.
Ma'am, you are not audible, ma'am.
Thank you very much, sir. Shall we share the PPT, sir?
Yes, ma'am, yes.
Dr. Dharani, is it visible?
No, ma'am, no.
Okay, and you please tell me my voice is audible.
Ma'am, it is visible, ma'am. And you
No,
are
my voice
audible.
is audible. Yeah, okay.
Yes, ma'am.
And is it moving? I'll just. Is it moving?
Yes, ma'am, yes.
Okay, okay. So thank you, Dr. Praveen. So I take this opportunity to thank management and chairman, the head of the Department of Pharmacy Practice and principal of St. Peter's organization. Once again, I'm very much thankful for this opportunity. So, I mean, it is a very good topic to discuss today about the medication errors. So it is a very, it is like ocean, no, this medication errors, there are different types of medication errors. Um, the time which is given to me is just 30 minutes. So I wish, I think Dr. Dharani should give me a warning message at the end of 25th minute so that I'll take another 10 minutes to complete this session, because it's always easy for 1 hour session for preparing any PowerPoint slides. But if it is 30 minutes, you have to be very crisp, and also it should be interesting. And so what I have done is, like in this medication dispensing errors, I've taken up only the dispensing errors, because you have prescription errors, you have administration errors, wherein the nurses make these errors, even the pharmacist also, clinical pharmacist, they make this administration errors during the ward rounds and then the discharge medication counseling, and many of the pharmaceutical care activities. But why I have taken this particular title is like medication dispensing errors is it is very common for starting from community pharmacist to hospital pharmacist to clinical pharmacist. So any students or anyone attending this particular webinar will be this particular topic will be very useful for them. So whenever they go as a clinical pharmacist, or they go as a community pharmacist or a hospital pharmacist. So it is a very, very general topic wherein we'll be discussing about what is this definition of this particular dispensing error, and what are the strategies to prevent the dispensing errors. And I'm not going to really discuss this good dispensing practices because it is a topic by itself by WHO. Because of the time constraint, maybe one or two slides I will be discussing about this good dispensing practices. So as far as possible, I have put in a lot of examples for you to understand where exactly this dispensing error happens, and then that will be a very learning experience as a students. And I think many of the students of PharmD second year to sixth year will be attending this particular webinar, and I wish all the best to all of you as a good learning time for you, and some take home message from this particular webinar from all these three sessions. So we'll see some definition. What is this medication error? So the United States National Coordinating Council for Medication Error Reporting and Prevention defines as a medication error as any preventable event. See, this is what is very much required. See, when you whether it is a dispensing error or a prescription error or administration error, so any type of error can be preventable. So that is why the definition starts with it is a preventable event that may cause or lead to inappropriate medication use or patient harm while the medication is in the control of the healthcare professional, patient, or consumer. So such events may be related to professional practice, healthcare products, procedures, and systems, including prescribing, order communication, product labeling, packaging and nomenclature, compounding, dispensing, distribution, administration, education, monitoring, and use. So you name any of the activities, so which includes all the pharmaceutical care activities. Wherever the problem comes, then based on and because of medication, then you can call it as a medication error, and it is a preventable event. So I'm not going to discuss all the factors of this which influences medication errors, because I think as the chairman has discussed in the initial part of this particular webinar, the statistics of this medication errors, and then who's responsible for this, all those things is discussed. And then in the subsequent, the second and third speakers also will be discussing about many of these medication errors, what are the factors of it, and then how this clinical pharmacist is going to stop this or doing some intervention in preventing this medication errors. So these are some of the factors, that is the factors associated with healthcare professionals, and also like the factors associated with the patients, and some of the factors which the work environment, which I will be discussing because this is most important for the dispensing environment, how this is particularly influencing, and then for making of any medication errors during dispensing, or as a clinical pharmacist when you take the medications from the inpatient pharmacy and then you dispense to the I mean about to be discharged patients, that is discharge medication counseling you will be doing. So that time, what are all the errors of omission and errors of commissioning you will be doing it. So all these things in the subsequent slide we'll be discussing, and some of the factors associated with medicines, that is your I'll be discussing about the LASA, that is your look alike and sound alike. So that will be the major part of this particular session. So I'll be discussing about these things also, and also like some of the factors associated with the task, like pharmacists will be repetitively doing many of the activities, and how does it going to affect and cause the medication errors, and how this is very important in avoiding and also the prevention of medication errors, and also like the factors associated with the computerized information system, like the difficult process for generating the first prescriptions, and also like repeat prescriptions, refilling orders. So how does this is contributing in causing the medication errors, and also like primary and secondary care interfaces. So see here, this particular aspect is a lot more. It is causing on the aspect of this medication errors is like the communication problem between the primary to secondary and secondary to tertiary care, between the prescription to nurses, nurses to the pharmacist, and pharmacist to the this thing. So it's a vicious cycle wherein any part of this particular chain, it can cause the medication errors. So in a nutshell, if you see, the medication orders can, errors can occur in ordering, prescribing, or documentation. So during the transcription, or while dispensing, or administering, or monitoring. So we are going to discuss in this particular next 30 minutes only about the dispensing errors. How does it causes problem to the patients? So when you see this medication errors occurrence in the hospitalized patients, the statistics, if you see, the physician ordering will be of causing 49% of prescription errors, and while transcribing whatever the physicians order into the other medication records by the nurses or the pharmacist, is another 11%. Nursing administration errors will be another 26%, and dispensing errors will be around 14%. So this is of 2018 statistics. So it might be much more than in another, I think, past 2 or 3 years. So when you see the definition of this dispensing errors, the discrepancy between the written order in a medical prescription and following of this order. So when there is an error which occurs between this written order and whatever you follow as a pharmacist. So these errors are made by the pharmacy staff when dispensing to the hospital units. And also these errors will be made by the pharmacy technicians. This concept of pharmacy technician is not there in India. So because we have a diploma in pharmacy and degree in pharmacy and post-graduation and pharmacy pharmacist. So there are many categories of pharmacists available in India. So there is no technician concept. But in abroad, the medication errors are caused even by the pharmacist technician also. So not necessarily the pharmacy staff causing the medication errors, even the technicians also will cause the medication errors, and it is the duty of the pharmacist to sign in that particular form or in the prescription while dispensing. So I think all of you know that dispensing is an integral part of quality use of medicines, and together with the patient counseling form the core professional activities of a pharmacist. So it is his responsibility. So see, this is the one aspect of area, that is pharmacy practice. So whether you are a diploma in pharmacy or a degree or a PharmD or whatever be your qualifications, once you are assigned this job of providing the pharmaceutical care to the patients, so that is nothing like the knowledge that is only the basic level is required, or higher level is required, or the highest level is required. So you have to read at the level of whether it is a diploma or PharmD 6 years course. So everything has to be studied, and the knowledge of the drug and the knowledge of providing the pharmaceutical care is a part and parcel of any particular curriculum, and any particular pharmacist has to know this area. So otherwise you can't say. See, if you see any of the pharmaceutics or analysis or any other area of the pharmacist who's doing that particular activity, so there is always a level of whether it is a low level or medium level or higher level, average, excellence, and all those things. But in case of pharmacy practice area, you are dealing with the human beings, you are dealing with the patients. So you can't have any excuses that you are at a low level and I know only this part of the things and other things. So you can't have an excuses of these things. So once you're dealing with the patients, you have to know and sufficient knowledge, and then how to acquire that particular knowledge by experience, and all those things you are supposed to learn. So as a student, you have to understand all these things. So it is a safe, organized, and effective dispensing system, or the fundamental to ensure that the drugs will be properly dispensed according to the prescription order forms, and to reduce the possibility of the errors. So this is the basic definition of dispensing. And the errors in dispensing, the rates of drug dispensing errors in the work environments is high, leading to interruption, distraction, noise, and overload. So it may be of around 3.23% as compared to the environment with the lower level aspects of 1.23. So we will see some of the pictorial representation of how much, what type of environmental issues and other issues are causing this particular problems. So dispensing errors, if you see, it may be a diploma in pharmacy or your pharmd pharmacist who are involved, because in abroad, if you see, there is no difference between there is no diploma at all. So the degree pharmacists, they are called as the hospital and clinical pharmacist. So they dispense drugs, as well as they inpatients also, they assigned wards will be taken up by this clinical pharmacist, and then they take up the drugs from this OP pharmacy or the in pharmacy, and then they'll be dispensing to the patients who are admitted. So during the in-stay and as well as while discharging also, it is a responsibility of the clinical pharmacist to provide the medications to the patients, as well as pharmaceutical care to the patients. So it may be due to various aspects the dispensing errors can be caused. So it may be your illegible handwriting, and very long prescriptions due to polypharmacy, and it can be due to billing error, and also like picking wrong medicine from the shelves. So some of these particular things also may cause the medication errors, and interruption by the telephone, improper mood of the staff, and errors during the verbal communication, and also the queries by the staff. So when OP pharmacy, you can see that at least 10 to 15 pharmacists will be simultaneously working, and then they'll be discussing each other in case of any problems, and that time there could be possibility that the medication errors can happen. So it has happened in such a way that I always tell this particular example. It has happened when I was working in Christian Medical College, Vellore. So I was graduated from Christian Medical College, Vellore, Tamil Nadu. So it has happened once, I think. The mother came with a child, and then the prescription was given to a pharmacist. So that time I was a student doing internship. So what has happened is, like, amoxicillin syrup was given. So it was strawberry syrup, flavored syrup, and it was given to mother, and the pharmacist told that it should be taken 3 times a day, and then it should be given to that particular child for 3 times a day. So what has happened is, the mother has taken that, and then the child had a problem in the ears. So it was otitis media problem. So it is an ear infection. So it was given oral medication actually. So the amoxicillin antibiotic was given oral medication, but this mother has taught that 3 times it has to be poured inside the ear. See, it is a one small patient counseling information which has to be given to the mother, that it should be taken orally 3 times a day. It should be given to a child, but just that one word is it was missed, and then the mother thought that because the problem was in the ears, and it was poured, and after 3 days the babies, the whole area of that left side ear was swollen and then pink in color, because that syrup was pink in color. So she was constantly pouring inside, and then the second day she found that something wrong, and then she came to the hospital. So this sort of problems, nobody can think of what type of mistakes can happen, and what type of mistakes can be made by the patient attendant. So especially with pediatrics and geriatrics, this is a very common problem, when the pharmacist is not going to provide a proper information or the proper pharmaceutical care to the patients to avoid the medication errors. So this was one study, which is an observational study to evaluate the factors which influence that how the dispensing errors in the hospital pharmacies of a tertiary care hospital is affected. So what are the outcomes of this particular study is that in a filling stage, many of the dispensing errors are happening, and also whenever any drugs are being supplied to the inpatient pharmacy, then there the major problem. So apart from your wrong patient or identical package, identical name of the drugs, your Lassa drugs, and all those things. So the major problem with the dispensing errors occurred with the during the filling stage, and also during the when you supply drugs to the inpatient from the inpatient pharmacy. So now we will quickly move on to the categories of dispensing errors. So you can divide into content errors and labeling errors and documentation errors, many different types. So this is for the benefit of the students I have just put in. So it may be dispensing your incorrect drug, so different to that of whatever it has been prescribed, or it may be incorrect strength, so there may be different strength available for any particular medication, so you choose a incorrect strength to dispense any particular drug, and incorrect dosage form. So there are sustained release dosage forms are available, extended release dosage form, chewable tablets are available, simple immediate release tablets are available. So what is that? It has been mentioned in the prescription. Any pharmacist has to see. Otherwise, the dosage form, if there is a change, and it can have its effect. And then additional larger quantity of medications added, some missing doses, omission of any particular item. So whatever 4 to 5 drugs which are prescribed by a doctor, you omit any particular items and overlook that particular prescription, that everything is being dispensed, and deteriorated medication, so without seeing any expiry dates. And apart from this, any of these particular content error which is not under this category also will come under this content errors. And also, like, labeling errors are very common in any dispensing while dispensing the medications. So it may be your incorrect patient name. So there may be, in Indian context, there could be the same name of two different patients, and then there could be possibility of exchange of these drugs. It's a very, very common type of errors which can happen. An incorrect drug name also, it may be of, we'll discuss in the LASA also, like how this look-alike and sound-alike drugs are making a lot of issues. An incorrect drug strength, an incorrect drug quantity, an incorrect dosage form. So there will be a parallelly, there will be overlapping of labeling errors and the content errors too. And also, like, incorrect date, incorrect instructions, because this incorrect date is very, very important. Like, whenever you dispense any controlled drug like morphine, pethidine, and other things, the date is very, very important, because you cannot use that particular prescription after some time. And 3 copies of that particular controlled substance prescription to be stored, one for the drug control authority, one to be with the patient, and one to be in the hospital or in the community pharmacist. Then incorrect instructions, I think I gave you a best example of how this incorrect instructions causes problem with the patients. And additional warnings, like black triangle in British National Formulary Book, if you refer, so you will come across, like, so in metformin also, you would a very common drug like metformin, you come across this lactic acidosis. That's important additional warnings. And pharmacy address which is missing, and any other labeling errors which occurs also can cause this medication errors, and you have to be very careful. And also, like, documentation errors for control drugs, I think this also I told you, like, any of these controlled drug substances like sedatives, hypnotics, and all those things which is written, so it should not be reused to this prescription. So you have to be very careful while dispensing these things, and date is also very, very important. So these are all different types of things. And what are the errors which are perceived by the pharmacist? So there's also a study which has been done in one of the article which has been mentioned here. So too many phone calls is creating cause of medication errors, that is 62%. Overload around 59%. Too many customers, because in Indian systems too much of population. And in OPD you can come across around 600 to 1000 patients per day in any tertiary care hospital. And in government hospitals it may be more than that. And lack of concentration around 41%, and no one available to double check 41%, staff shortage 32%, similar drug names 29%, and no time to counsel 29%, illegible prescription 26%, misinterpreted prescription 24%. So these are all some of the errors perceived by the pharmacist. And we'll move on to the quickly to the type of dispensing errors. It is errors of commission and errors of omission. So dispensing a wrong drug, wrong dose, and an incorrect entry into the computer system, it is the errors of commissioning. And errors of omission, you don't dispense any particular drug, you avoid or omit, or even the activity, like you don't counsel any particular patient, that is also an errors of omission. So you don't care any particular patient on any particular activity, you don't do any intervention in spite of having a problem, so that is also comes under the errors of omission. So for example, like a patient with an oral candida albicans infection is prescribed fluconazole 50 milligram daily for 1 week. So instead of 50 milligram, fluconazole 200 milligram tablets are dispensed, and the full course was taken by the patient. So this is one example for the incorrect preparation. And dispense an expired drug. Okay, so out of date sodium bicarbonate is sent to the ward, And equipment failures like poor quality sticky labels will fall off syringes during transfer from pharmacy to the ward. So this also you will not know what type of injection it is and what is the name of that particular injection. And sometimes the I mean, when you call any particular like sound alike drugs, cefuroxime and cefixime and all. So the poor drug storage practice also, like potassium chloride is stored in a cupboard next to the sodium chloride. And daycare chemotherapy patients' drug information is lost in the cytotoxic office, resulting in a delayed dispensing of the drug. So these are all some of the examples for things. And what are the factors affecting the dispensing errors? So it may be workload. That's what we have seen, the time of the delay. So how the pharmacist is perceived, what type of things will affect, and then causing this medication errors. So it may be the experience of the staff. The person who is having a less experience could possibly that he might cause some of the more amount of number of medication errors. So we are going to concentrate in next few slides about the look-alike and sound-alike drugs, which is causing the major problems, and some few strategies we will see that how to overcome that particular one. So LASA, if you see this error-prone drug pairs causing the confusion, that is look-alike and sound-alike. So there are many categories are available. So almost 8 categories of this LASA. So we'll see the examples for all these things in subsequent slides, so that those examples will give you a clear-cut idea, like how pharmacists will be prone for making the mistakes, and even the nurses, how they are prone for making the mistakes. So the category 1 is like similar brand names and different generic composition. And also like category 2 is similar brand names and same generic composition. Category 3 is similar brand names with additional letter, and similar brand names of the antibiotic groups, that is category 4. This is very, very, very common. Two different antibiotics having the very close brand names, or the same antibiotics having the similar brand names. So the doctors will be, or the different brand names, doctors will be writing the same antibiotic twice. And then the same drug, different dosage forms. This also I'll show you an example pictorially. And category 6 is same drug, different release characteristics. So it may be like metformin immediate release, metformin sustained release, metformin extended release, metformin prolonged release. So each one has got a different um, type of release characteristics, and same brand name and different composition. So it is otherwise called as the caching on brands. So wherein you can see that even the market also, like some of the composition like painkillers and all, like local application ointments and gels are available. In maybe 5 years back, this particular composition may be different, but now they would have added a different drug in this particular, but the brand name will be same. So this is because they don't want to lose the brand value. Any company will not, once it is registered in patient's mind, they don't want to remove that particular brand name. So what they do is the generic composition will be different, but the brand name will be similar. So this may also cause the medication errors, because either the consumer or the patient or the doctors or the pharmacist, they will think that it is the same old generic drug. So this also could be a cause for the causing this medication error. And also like generic drug pairs. So this also we will see some of the examples. So these are all some of the types of LASA which causes the medication errors. See, here onwards, it's more of an example, because I wanted to save time and make it very crisp. Within 30 to 40 minutes, I want to complete this particular session. So that was the condition which is given to me. So pardon me, I could have given more examples and more things for this, but still 30 minutes crisp thing will enter into your brain as a student. So here you see this is lookalike drugs. The package is same. The one is a Zemfibrozil tablet 600 mg. The other one is a gabapentin. So entirely, this both are different category of drugs, and there could be a possibility of medication errors while dispensing this. And then you see this similar lookalike like ranitidine 150 milligram and ciprofloxacin 250 mg. And there are something like these examples, if you see, there are more prone for illegible writing. So when you see this type of drugs which are written in the prescription, there could be possibility that the pharmacist can, instead of Arlidin, he might think it is Artidine. Instead of Enam, he could have thought Isam, or it may be Dimol, or it is maybe Imol. Imol is your painkiller. Dimol is your anti-diabetic medication. So this is also a case history which has happened in my hospital. Like the patient was prescription containing antacid. the similar anti-diabetic medication having the similar, brand name was dispensed. And I think you know that antacids are taken the patient whenever on a SOS basis, or sometimes 3 times or 4 times whenever he wants. So a patient thought that it is an antacid, and then he took this anti-diabetic drug. He went into hypoglycemia, and then he was in ICU for almost a week's time, and then they could save the patient later. So you can imagine that how life-threatening when you do a medication error of whether it is a Lassa drugs or whatever it is. So this type of illegible medicine names, when it is written by a doctor, the Medical Council of India, and even if you see in the internet, the Maharashtra Pharmacy Council or Maharashtra State Pharmacy Council also, they have put in that how a prescription should be, and how it should be written in capital letters and in generic name. So what exactly it should be written on the prescription. So all the guidelines are given by both Medical Council of India, and as well as in Maharashtra also it is implemented in a very good manner. And then you see this errors due to similar names of formulations. So it's a domperidone combination, as well as the domperidone as a single drug. So you can see that all look like Domestal OD, Domestal RD, and then Domestal O. So there could be a possibility that the medication errors can happen. The same thing, the anticoagulants like clopidogrel and aspirin. So when you go and ask if a pharmacist is available, you will be able to find out whether the patient is asking 75 mg of clopidogrel or 150 mg of clopidogrel, or is it a combination of clopidogrel with aspirin. So these things, you have to be, because it is um, drug anticoagulant, you have to be very, very careful. So this sort of problems can occur. So this is a best example for how any similar names of the formulations and even the similar trade names or brand names are available, how the medication errors can be caused. And then this is drug available as a different formulation. So one is a DT, and another one is a capsule, another one is a tablet, and one is fast releasing tablets. So you can see that it is an extended release. So when a patient comes for a dispersible tablet, there could be chances that extended release tablets could be dispensed. So because, see, all are Blue Mox. So the trade name is Blue Mox. Different strengths are available, and different dosage forms are available. So you can see that how the Lassa is creating problem here. And the exact local preparations, this betamethasone and clobetasol, so these are all some of the exact local preparations which are available. They get confused which one to be given. So because of, see, some of the examples whatever we have seen for the Lassa, and also this particular example, this case history is more of an administration error, and also this could be possibility that the pharmacist while dispensing also can cause an error. So it is the responsibility of a clinical pharmacist or any community or hospital pharmacist to counsel properly any diabetic patients. See, when you see this particular case, a patient recently been prescribed with insulin 10 international units. The physician explains about how to use the syringe, because the problem comes with the syringe here. So generally, no, syringe means we think that it is marked in ml. It is 0.1 ml, 2 ml, 3 ml, like that. But in insulin syringes, it is marked as units. So you have to explain to the patients that how the error can be prevented here. So you can see here, insulin syringes are marked in units. See, 5 units, 10 units, 15 units, and 20 units, and 25 and 30 units, like that. So the patient might think that this is all in ml, 10 ml, 5 ml, like that. So you have to explain. So if it is an 100 units, the 10 units will be only 0.1 ml. So if it is a 40 units, then 0.25 ml consists of 10 units. So these things, first, any pharmacist should learn that how these units are divided, how many ml is equivalent to how many units. Then the pharmacist needs to explain to the patient. So there could be a lot of possibility that hypoglycemia can happen if more excess of insulin is being injected. And also, you see this particular example, this carton is labeled as cisatracurium pesylate injection USP. But inside bottle, you see, it is mislabeled as phenylephrine. So actually, this contains the cisatracurium, but the labeling is phenylephrine. So this is also a medication error. So the pharmacist or the nurses would think that it is Sistra curium, and unnecessarily it causes tension among the nurses as well as the pharmacist. And also, like, it is dangerous wrong route errors with the tranexamic acid. So you see these three bottles. The first one is the bupivacaine, and the second one is tranexamic acid, and the third one is the ropivacaine hydrochloride. So all the bottles contains the blue cap. So this caps on ropivacaine, bupivacaine, and tranexamic acid vials will have the same blue color. So what is the tendency of the nursing staff or the pharmacist is they will be remembering the color of this particular container. So whenever ropivacaine prescription comes, there could be possibility that because of its blue color cap, tranexamic acid can be dispensed or bupivacaine can be dispensed. So this is also like one of the medication errors which can be caused. And you see this verapamil and naloxone look-alike vials. So these vials are also of the same size, same shape, and then the cap also will be same color. So this vials look similar enough to create a risk of mix-ups. So this is also causing a lot of problems and then creating a hell. So then packaging could lead to acetaminophen overdoses. See, you see this pain relief acetaminophen. See, generally any of these liquid medications, you have to mention that the given 5 ml contains how many milligram of that particular drug. Okay, so each 5 ml contains 500 milligram of acetaminophen, or each 15 ml contains 500 milligram of acetaminophen. So it should be written on the label. But in this particular label, if you see this here, pain relief acetaminophen 500 milligram, pain reliever and fever reducer. So how many ml of this particular syrup contains 500 milligram? It is not mentioned here. So you have to know volume is listed to help the users to recognize the product strength is 500 milligram in 15 ml, which is equivalent of approximately 1 tablespoonful, whether it is mentioned or not. So this also like labeling error, packaging error, all these things also will contribute the medication errors. So what are the strategies for, see now I think we have seen more examples for this medication errors, different types of LASA. So how exactly? So ISMP, I think most of you, maybe in 5th, 6th year students and then faculty will know that www.ismp.org, Institute of Safe Medication Practice. So what they do is like, they give a set of this thing for the strategies to overcome this medication errors. So it is a website which gives you very useful information. So all these informations are available in this www.ismp.org, and there are a lot of recommendations are given to avoid this medication errors. And whenever you go for ward rounds and then you come across any of the medication errors, you can report it in this particular website. So just like ADR monitoring in US FDA or your Indian CDSCO websites and other things you reported, the same way your medication errors also can be reported in this particular ISMP website. So that website gives you a lot of strategies to overcome how to overcome this medication errors while dispensing or even the administration or the prescription. So one such is like oral dosage forms that should not be crushed. So there is a list of, I've given you only this 5 examples, but A to Z, there are a lot of examples are given. You please go and see and learn. So it is a learning period as a student. So you have to learn that how any chewable tablet should be taken, how any sustained release tablet should be taken, how dispersible tablet should be taken, whether any sustained release tablet should be crushed or not, and how it should be done. So all these instructions are given in this particular thing. And also, like, there is another strategy to overcome medication errors is that while writing any prescription, use of Tallman letters. So you see this astazolamide. So some of the letters will be capital and some will be smaller letters, so that it catches your eyes easily, so that you will not make mistake while picking up from the shelf. So you see this example of bupropion. So PROP is in tall letters. So this is called as the Tallman letters, which will avoid. So FDA gives you like A to Z how to write this particular drugs which are of similar sounding, not sounding, it is actually the look-alike brand names or the generic names. So how you can write it in the prescription so that you can avoid the prescription errors. And also it is easy for storing the drugs in the hospital pharmacy as well as in the inpatient pharmacy also. There are some high alert medications. So I told you, like all the insulin, anticoagulants. So all these things will be high alert medications. So these particular high alert medications, which are in the long term care settings also, you have to be separately, you'll have to store it so that you avoid the medication error. So it may be your antithrombotic agents, anticoagulants, chemotherapeutic agents, immunosuppressants, and then insulin, your methotrexate, phenytoin. So all those things which comes under your high alert medications, separate cupboard should be there. And in that also you will have to separate based on your Tolman letter. And also list prone abbreviations. So unnecessary use of abbreviations like CC, IU and all. No? So you will have to expand this particularly, expansion of this particular to be taken care of by the physician, so that the pharmacist will not make mistake. So even if there is a problem while dispensing, the pharmacist has to confirm with the prescriber that whether it is mentioned as MCG or IU or CC or whatever it is. Okay, so there are a lot of mistakes can happen because of this error prone abbreviations. So this also given, a lot of list is given. This is just an example which is given here. And the drug name abbreviations also, like the abbreviations like APAP for acetaminophen, AZT for zidovudin. So, as far as possible, abbreviation should be avoided. So, the lot of drugs, the abbreviations which are used are given in this particular area. So, you can just go into the ISMP and then check how best this should be. And you have to give while training this pharmacist or nurses or doctors. So you have to give a training on how best to avoid this drug name abbreviations. And also, like, there are, excuse me, there are something like stemmed or coined drug names. Like the nurses will generally use this for nitroglycerin infusion. They call it as nitro drip. And for intravenous vancomycin, IV vanc, and levofloxacin, they call it as levo. Excuse me. So these sort of stemmed or coined drug names, always it is mistaken for something else. So you have to be very, very careful while using this particular stemmed or coined names. Day-to-day practice, nurses generally they use this particular type of names. So it is the clinical pharmacist duty to tell them like how best this can be taken care and how best it is mistaken for something else, and it can cause grievous mistakes on the patients. So now we'll move on. I think I have come to the fag end of this particular session. So I hope I've kept with my time. So good dispensing practices by WHO, it gives you like almost 40 to 50 guidelines as such in the good dispensing process, which I'm not going to discuss here. You can go into the WHO website and then you can just check it. So what they say is that whenever you receive any particular prescription, so as a clinical pharmacist, you dispense to the inpatient, or as a hospital pharmacist or as a community pharmacist, first receive and validate the legality of that particular prescription, whether it is written by a doctor, and understand and interpret the prescription, prepare and label the items for a issue. So before issuing also, you'll have to the whatever the medicines, all those things, because in the filling stage lot of problem comes. So in the filling stage, you will have to check with the cross check with the prescription whatever it has been given, and then make a final check. It is always advised that one more person has to check that particular final check and then record the action which is taken. Then you issue the medicines with the proper patient counseling information. So this will be a very nutshell according to the WHO good dispensing process. There are various strategies which are there, which there's no time to discuss here, but you please go through. It is good PPTs are available in WHO websites on the good dispensing process. So you can just go through that good dispensing process, so how best in pictorial representation it is given. So this is my last slide. So what does it say actually? So how to implement, this is given by this particular picture. I have taken it from the ISMP website. So very beautifully it is illustrated that how best the system needs to be done in any particular hospital, and how the human reliability is taken care, so that you are able to implement and avoid medication errors. So like system reliability, you have to put in some system that is which is of an high leverage, that is forcing functions, barriers and fail safes, and automation and computerization. So when you do these type of activities, this will be most effective, and but it is very very hard to implement, because it will be a cost incurring process, and also the whole system and the whole people have to follow this particular one. And but you get a very good output, and then you can reduce to a bare minimum your medication errors. And medium leverage will be like standardization in the protocols, like having a hospital formulary, I mean, implementing the rational use of drugs, and then standard treatment guidelines. So all these standard things, when you implement it and then you develop a system, then it is, I mean, it will be a almost an average effective source for avoiding the medication errors. And also like the old system of redundancies, always you will have to avoid. And then the warnings, alerts, and reminders and checklists. So especially like when antibiotics are given, so how best it should be stopped at the end of third day or fifth day during the patient's stay in the hospital. And then who's going to take care of this particular one? So the antibiotics monitoring committees will be there under your the other committees, and other things will be taken care of. And then so that will be like all these things which are in the orange color and then the red color, that will be of most effective one. And also like the system has to set in. But when you want to rely on the human beings, that is, you want to rely on the pharmacist, you want to rely on the physician and the nurses, you develop a rules and policies for the hospital, you develop a educational programs, and whatever the available information you set in. And then the suggestion to be more careful. So always you say that you have to be more careful while dispensing this, and then this is an high alert medications and you have to be storing it separately. And frequently you conduct some educational programs and take the feedback. And then some of the rules and implementation of the policies through your drugs and therapeutic committee. So all these things will be least effective, but these are all very easy to implement. But how much it is going to be effective, unless and until repeatedly you do it, then it is not possible for any hospital to expect the reduction of medication errors or even the implementation of any pharmaceutical care services to the hospital. So when you want to have a 100% foolproof medication errors reduction in any particular hospital, the system should change. So, I mean, from higher to lower, if you see, you can start with the least effective methods of implementing some policies and rules and regulations in the hospital. Then you go ahead with the change of systems, and then standardization of the protocols, and then the automation and computerization techniques. Though it may be very hard to implement, but that will give you a very fruitful outcome for the hospital. So, and that will be the most effective one. So, I think. Um, this gives you like a nutshell of what type of I mean, dispensing errors, which is always happens in any particular thing. um, I think I've completed this particular session. So any doubts or anything, if you want to ask, you are open, and the session is open. And Dr. Dharani, I have kept my timings.
Yes, ma'am. Yes.
Yeah.
And ma'am, there is a question from Dilgit.
Yeah, yeah.
Ma'am,
One
can
minute.
you see the
Yeah, I'm just trying to escape this particular
okay, ma'am.
this thing. So it's not. Yes, yes. So the last slide talks about an error doesn't become a mistake until you refuse to correct it. Okay. So with this quote, I just completed my session, and thank you for your patient listening. Thank you once again. So welcome any queries.
Ma'am, can you see the question on the screen, ma'am?
Yeah. Is there any questionnaire or survey that measures the causes of medical errors? Yeah, I think there are lot many. I mean, medication errors are not a new topics as such. So it is a age-old topics. So when the drug is born, the medication error is also equally born. So I mean, when you do a literature review of any of the international journals or local journals, definitely you get a questionnaire on these particular one. And then what type of medication errors? Because it's a very, very, very broad term. this medication errors. So whether you are looking for administration errors, then you have to go and talk to the nurses. So if you are going to check the prescribing errors, then you are doing an auditing, then you will be in a soup when you go to hospital and check with the doctors. So you have to be very careful and take the permission from the doctors. And if you want to check with the dispensing errors, which is happen in a day-to-day practice in a dispensing area, that there also you will have to separate it out whether it is a community pharmacy, then you go and then work in a community pharmacy and find out. And hospital pharmacy you can sit and then you can find out, or it is happening in any of the theater pharmacies if you go, because there are satellite pharmacies are available in many hospital. Satellite pharmacies means, I think you know, like one pharmacy in OP will not be sufficient for dispensing drugs to the patients comes to the hospital if it is 2000 or 3000 load per day turnover. So satellite pharmacies in department wise, they open up the pharmacy, and then or every 3 or 4 wards they will be having one satellite pharmacy to dispense. So where exactly this problem is happening, where exactly this medication errors are happening, you have to sit there and then you have to watch, and you'll have to see and you have to document, and that is possible definitely. Hope I answered your question.
Yes, ma'am. It was a wonderful session, ma'am. We are extremely honored to have you here, ma'am. Thank you for being a part of this webinar.
Yeah. Thank you, Dr. Dharni, as a convener, and thank you for this opportunity to deliver this webinar for students. So I don't know how many of these students have attended today. May I know how many has participated today
Ma'am,
online?
actually 800 registrations was completed, ma'am.
No. Like registration is always it gives you number, but the people who come here will be exactly 50 or 30%. So I think whoever it is, even if it is a one student is benefited by this session as well as the following 2 sessions, we are very happy, because WHO also says that when you train 100 students or 100 participants, they expect
Yes,
at
yes,
least 2 to 3% output.
yes,
So
ma'am.
even if there is any 100 students are here, and if take home message is taken, and then if you implement some of the things for your hospital, we are happy. So I take this opportunity to thank St. Peter's management, the chairman of the St. Peter's organization, the principal, and the HOD of pharmacy practice, and other teachers for this wonderful opportunity to me. Thank you once again. Thank you very much. And thank you, participants, wonderful participants. And only one question, but still it is a good question. Thank you very much.
Thank you, ma'am. Now let's move on to our second session. I would request Dr. P. Ranadeep Chowdhury, Assistant Professor, St. Peter's Institute of Pharmaceutical Sciences, to introduce our speaker, Dr. K. Santosh Arun Kumar.
Good morning, everyone. Our next speaker is Dr. K. Santosh Arun Kumar, Assistant Professor at Andhra University College of Pharmaceutical Sciences, Visakhapatnam. Dr. Santosh completed his PhD in the year 2020 at Andhra University College of Pharmaceutical Sciences. He has a 10 years of teaching experience and guided 38 PharmD students and 12 MPharm students. Dr. Santosh has a total of 9 publications in various reputed journals. He is a reviewer for several journals and editorial board member for World Journal of Current Medical and Pharmaceutical Research. He has actively participated in several conferences and workshops, and also a life member in several reputed pharmacy associations. I'm happy to welcome you for this wonderful webinar, sir. Thank you.
Yes, am I audible?
Yes, sir. Yes.
Yeah. Very good morning, and thank you for having me here in this webinar. And thank you so much, Dr. Ranjit Chaudhary, for your kind introduction. And I always welcome the participants who are watching the YouTube, and also the participants who have registered for this webinar. I thank them, and I also thank the organizers, the St. Peter's Institute of Pharmaceutical Sciences, and especially Dharani, who is constantly in contact with me and made this webinar a very huge success. And shall I share my slides?
Yes, sir.
Yeah, thank you. the slides visible?
Yes, sir.
Right. So my today's topic is the preventive steps to reduce medication errors and the role of clinical pharmacists in reducing those errors from reaching the patients. So I welcome once again everyone for this webinar, and as the first speaker has already covered regarding the medication errors introduction and also regarding the dispensing errors, so I would like to continue with that particular topic. So I'm focusing only on the preventive steps to reduce medication errors. Now, Dr. P.K. Lakshmi ma'am has very well demonstrated regarding the medication errors, then the types, then the causes, and also focusing on the dispensing errors and also the examples. So she has reduced a lot of burden on me in giving the introduction, such that I can continue with the topic of errors. So coming to the overview of my presentation, I would like to give focus on a small introduction, a very crisp introduction regarding the medication errors, then the factors which are responsible for the medication errors, then how to detect the medication errors. Now, upon detection, then what is the role of clinical pharmacist? How a clinical pharmacist can analyze those medication errors, then how to prevent the medication errors, what are the steps to be taken, okay, and finally some conclusion points, take home points. So I think I can justify this in the next 20 to 25 minutes. So that's what the time slot given to me. I hope I cover all the topics and justify this. So coming to the introduction, now primum non nocere. This is what is said by the Hippocrates, which means that first do no harm. So in the healthcare settings, especially in the all the medical team members, they follow the above said proverb, like there is primum non nocere, which is nothing but first do no harm. So patient safety is of utmost importance, and in medical settings especially, the outcomes is what very much important. Now the patient outcomes may be positive outcomes, that is the patient is cured with the disease or there is an improvement with the patient health, that is a positive outcome. When it comes to a negative outcome, the health condition has got worsened even after a treatment, so that is a negative outcome. But the neutral outcome is nothing but a patient is neither harmed or nor got healed with the previous condition. But here what we are focusing is a better patient outcome, that is a positive outcome. But the in this process of positive outcome, medication errors do happen and they are reaching the patient, but medication errors are 100% preventable. So, with this small introduction, I would like to focus on the next slide, which is nothing but regarding the safety in the primary care settings. Now, we all know that in the primary care settings, tertiary care, secondary and tertiary care settings, all the healthcare professionals, the doctor, the nurse, the clinical pharmacist, and all healthcare professionals, they work very hard for the better outcome of the patient. And all these activities will revolve around the patient. Now, this is why we call it as a patient centered focus, where the patient is at the center and all the activities for a better outcome of the patient, we all strive, healthcare professionals strive for the betterment of the patient. Now, this is also where the concept of pharmaceutical care has emerged with the patient centered focus. Now, health services always try to provide care to the patient when they are unwell. They assist them in a lot of ways, and also they work hard to provide safe and high quality care. But unfortunately, to error is human, and at times patients may be harmed by the prescriptions what was given. So it may be the drug related problems like drug interactions, adverse drug reactions, then other human errors like unable to take the medication, or medication which is prescribed for a condition which is not at all present. So these kind of errors do happen. And apart from the drug related problems, we also have medication errors, where these medication errors, which are 100% preventable and avoidable, they cause a lot of injury to the patient's health. Now, this will lead to unnecessary hospitalizations, sometimes cause disability and even mortality, that is, death. So one has to understand that the medication errors are 100% preventable, and as a clinical pharmacist, we have to uh, identify the medication error and stop the error from reaching to the patient. Now, yeah, of course, regarding the introduction, it's mandatory to have this definition already, which was discussed by the first speaker, Lakshmi Madam. So, according to the National Coordinating Council for Medication Error, NCCMERP, Medication Error Reporting and Prevention, and also the same definition was adopted by WHO and also the FDA. It's a universal and widely accepted definition for medication error. Any preventable event. So the definition starts with preventable event. So it is very much understood that the medication errors are very much preventable. So these may lead or cause to inappropriate medication and causes patient harm. So medication errors do harm the patient. And while the medication is now in the control of either the healthcare professionals, either the patient or the consumer. So healthcare professionals, in the sense, the administration role of the medications, especially to the inpatients who are admitted in the hospital, the administration role is taken by the nurse. Now, nurse is given the responsibility for administrating the medications, and she is in control of that particular medicine. And in outpatients or ambulatory patients, now the medication is in the control of the patient who self medicates or who takes the medication by himself or herself. Now, this is known as medication is in the control of the healthcare professional and patient. So, whatever may be, either the healthcare professional or the consumer or the patient can uh, is responsible for the error which was very much preventable. Now let us focus on the events that may lead related to this. Now, firstly, I will discuss regarding the events like professional practices, healthcare products. Such events are related to this, and procedures and systems. Now, system-related events include the errors may happen at any stage of prescribing, while order communication, while product labeling, packing, and nomenclature, compounding the medicines, dispensing errors, while distributing the medication, while administrating the medications, and also while education or due to lack of proper training. So education in the sense, if there is no sound knowledge for the healthcare professionals how to administer a drug or how to uh, give a drug to the patient, and of course the monitoring errors and use. If one doesn't know how to use a particular dosage form, how to open what you call uh, the blistered tablets packing, or how to administer insulin, and or how to use an inhaler using a spacer, so these all comes to the administration errors. So at all these stages, it is very much possible that errors do happen, and clinical pharmacists at each and every step should make efforts to identify the errors, at what stage the errors has happened, and he has to stop the error from reaching the patient and causing potential harm to the patient. Now, why medication errors are so important to be detected? Because medication errors are a serious health problem globally, and it's a major cause of death, especially in United States. So developed countries like United States and UK, United Kingdom, even though they have the better healthcare settings and they use sophisticated procedures and machines, computerization of prescription orders, etc. But even then, a lot of medication errors do happen in the healthcare settings, and of course, they lead to serious public healthcare problems. Medication errors especially lead to increase in the length of the hospitalization of the patient, which in turn leads to the increased healthcare costs, which causes a lot of discomfort and disability and increased mortality rate in the patients. It is a very challenging role for the clinical pharmacists because a lot of steps do happen right from the prescribing, dispensing, and of course, transcribing errors and also the administration process. So, clinical pharmacist, right from the prescription, right from the dispensing, the clinical pharmacist should monitor each and every step that is taking place in the healthcare system. And these events happen randomly and very fast. And also, the patient ratio to the pharmacist is also very huge. So one clinical pharmacist should take care about, for example, in the Indian settings, should take care about 40 patients. Okay, so it's merely a Herculean task for the clinical pharmacist to monitor all these steps and to identify the errors. Apart from the drug-related problems like drug interactions, adverse drug reactions, etc. Now, the solution for this particular medication errors is the good news is all errors are preventable. So, therefore, there are many chances that or opportunities such that the clinical pharmacist, if he or she is vigilant and active role, has an active role, they can minimize the occurrence of these errors which causes potential harm. And underreporting of medication errors is of a very major concern. Errors do happen and they are not actually reported. Now, there is an opportunity for the clinical pharmacist here to play a key role in identifying and reporting the errors and discuss it with the concerned healthcare professionals and improve the quality of the healthcare that is offered by that particular hospital. Now, opportunity for constructive changes is always present, and clinical pharmacists should grab that opportunity. Okay, and they have to show that they are really can be reliable and they are very much helpful for the better outcomes of the patient. Now, clinicians, even though they are aware of the medication errors that are happening, they fail to report, especially because they they feel very much guilt or inadequacy, and almost some people, some physicians also will get into severe depression because error happened due to their negligence or due to their failure. So they consider it as a bad thing or a failure, and therefore that's the main reason why they underreport. They don't want the error to be exposed or to be known to other healthcare professionals. So this is the main reason what many studies has shown. So underreporting is very much present even in the developed countries. There is a threat of impending legal actions. So also healthcare professionals, they have a threat for impending legal action and also loss of clinical confidence and also breach of public trust. And of course, if the patient is harmed due to this particular medication error, then clinicians, they never want to really report that particular medication error because it has caused potential harm. Now, coming to the harmful effects, what the medication errors cause, let us see a list of harmful effects the medication errors may cause. The medication errors may cause temporary or permanent disability to the person, or damage to a particular organ, it leads to the increased length of hospital stay. So instead of 5 days, there'll be in a prolongation of 2 days of hospitalization. Now, which will lead to increased healthcare costs, obviously, and also sometimes may lead to severe morbidity and mortality. So these events will weaken the patient's trust in the doctors and the healthcare system, and therefore it will lead to bad hospital reputation. Also, the physicians or nurse who is responsible for that particular error, there is a chance that a personal and professional status and the confidence will be lost by those healthcare professionals. Now, the factors which are associated with healthcare professionals, they are lack of therapeutic training. Now, the nurses who are in the administration role, especially for the inpatients, if they are lacking in the training, especially when administering the IV infusions, the rate of infusion very too low or too high, that will lead to a medication error. The patient will have adverse events. A medication error, if it reaches the patient, it will lead to an adverse event. So adverse events are caused due to the medication errors. So due to the lack of training and due to lack of the knowledge, these medication errors do happen. And inadequate drug knowledge and experience, inadequate knowledge of the patient, when the patient is in the control of taking the medication, then patient should have enough knowledge how to take that particular medication, how to administer it. They have to follow the instructions given by the clinical pharmacist or the doctor on when to take the medication, how to take the medication, the frequency of administration, the route of administration, and also finally the duration of the particular medication. How many days you have to take the medication. Now, this knowledge should be ascertained through proper counseling by the clinical pharmacist, only by which we can prevent the medication errors from happening. Now, inadequate perception of risk is also very much important to discuss. Overworked or overloaded, especially the nursing staff or the physicians, if they are overloaded, it will lead to fatigue. And of course, if they are overburdened, then there is every chance that there is an administration error or transcription error or errors of omission may be happen. Now, physical, emotional health issues is also a very valid reason why medication errors happen. If the healthcare professionals are having any health issues, or they have any physical and emotional health issues, this also will lead to, they can't concentrate properly on their roles or on their job. Now, this will be an cannot be an excuse if the error has happened. And finally, the poor communication between healthcare professionals, and of course the health between the healthcare professionals and also between the patient and the healthcare professionals is also very important, and it must be taken into accordance with these factors that influence the medication errors. I think I'm clear with this. Now, coming to the factors which were associated with the patients. Now, we have discussed the factors associated with the healthcare professionals. Now, this is what healthcare professionals, where the healthcare professionals lack in the training, knowledge, and of course the uh, emotional health, and also the overload and poor communication. Now, let us see the factors associated with the patients. Now, the patient characteristics like the personality, the literacy, that is the patient's literacy and language barriers. So, most of the patients in India, they are multilinguistic. Some are very good at Telugu, some are very good at Hindi, some are very good at Tamil or other mother tongue. So the healthcare professionals who are from different state, they cannot communicate properly with the patients. So always there are patient-related barriers, also the provider-related barriers, and also the system related barriers. Patient related barriers in the sense, if the patient is unable to speak, or if the patient is unconscious, now at that times there is every chance that the error may happen. Also, when there is a language barrier between the patient and the healthcare professional, the patient can't understand how to take a medication and how to deal with his condition. Now, this is a very important factor which is associated with this medication errors, especially with the patients. Now, complexity in the clinical case. Complexity in the sense, if the patient is suffering from multiple health conditions, there is increased morbidity. Now, when the morbidity or if the patient is having multiple health conditions, now obviously the patient will be on polypharmacy, that is, he will be using a lot of medications. So when the number of medication increases, the chances of occurring medication errors also increases. So polypharmacy is what responsible, and of course, when the patient especially takes high risk medications, high risk medications in the sense medications with the narrow therapeutic range. For example, medications like digoxin, theophylline, even a small increase in the dose will lead to toxicity of that particular drug. So high risk medications, especially in emergency use, now those medications, if they are erroneously administered, will cause potential harm to the patient. Now, there are many other factors, like factors which are associated with the work environment, factors associated with the medicines, factors associated with the tasks which are assigned to the healthcare professionals, and also factors associated with the computerized information systems. Now, I'm not focusing on the factors associated with work environment, medicines, and of course the tasks and etc. And this is already discussed by the first speaker, Lakshmi Madam. The work environment involves poor lighting, then the services will be lacked due to unavailability of uh, the computers, unavailability of the staff, lack of staffing. So these are all the work environment factors which are associated. And the medicines in the sense look-alike medicines, then sound-alike medicines. So while communicating orally or verbally, the nurses, there may be a miscommunication. So, and also while writing the prescription, so illegible writing, then of course mentioning the abbreviations which are not at all approved. Okay, so there are a lot of examples can be given for these factors associated with medicines and tasks, and of course with computerized information systems. So I'm just focusing only on the factors associated with the healthcare professionals, because here my topic given is the preventive steps to reduce. So I'm focusing only on the clinical pharmacists, how they can identify and prevent the medication errors. So I'm focusing only on the factors associated with the healthcare professionals, and clinical pharmacist is also one such healthcare professional who can really play a major role in preventing the medication errors from reaching the patient. So one has to understand why they report medication errors. Medication errors, of course, it is a serious problem globally. So they increase the length of hospitalization and healthcare costs. Now, it is a challenging role for the clinical pharmacist to identify the errors, and to, if it is found, then the clinical pharmacist should provide a viable solution for that. Now, identification alone doesn't help. How to overcome and how to manage that particular medication error is equally important, and the clinical pharmacist should come out with a viable solution which can minimize that particular event that has occurred. Now, importance of detection here is the medication error which happened during the stage of prescription and during the stage of dispensing. If you identify the medication error in these stages, now you can easily prevent the error from reaching the patient. But if the medication error happens after the administration, so medication administration errors are very much important, because if the drug is administered erroneously, that indicates that the error has already happened and reached the patient. So prescription errors leads to dispensing errors. Dispensing errors leads to compounding errors, or other. Then, if the dispensed medication is administered by the nurse, then it is a very major problem. The administration process makes the error reach the patient. So the error should be identified by the clinical pharmacist well before the administration process. So it is important to identify the role in the prescription itself, such that it will not lead to the erroneous dispensing and also the erroneous administration. Okay, so it is very important to identify the uh, error in the prescription itself. So treatment chart review or medication chart review is the first step that the clinical pharmacist should do. So, by thorough reviewing of the medication chart or treatment chart, the clinical pharmacist can identify the drug-related problems and also the medication errors which are happen, prescription errors which happen. Now, once identified, then you can discuss the errors with the concerned healthcare professionals, and you should have in support for you the documents or the standard references in support for your intervention, and you can have a healthy discussion with the doctors and prevent the error from reaching the patient. Now, error detection is the first crucial step, and of course, it can happen in any stage of the uh, healthcare process. Now, coming to the methods how to detect the medication errors. So, we'll discuss regarding the methods of how to detect an error. So, only when you detect the error, then you can prevent it from reaching the patient. So, the preventive steps for the error starts from the detection. So, detection of errors is very much important. Now let us see the first step how to detect is, as I discussed earlier, the treatment chart review or medication chart review is the first and foremost step we have to do. Now by reviewing the treatment chart thoroughly during the pre-rounds before the initiation of actual ward rounds, the clinical pharmacist should review the treatment chart, make a note of all the drugs, their dosage forms, then the dose, routes of administration, the frequency, and also the duration was given. And you have to always, in conjunction with the nursing notes or the administration notes, you have to check whether the drugs which are prescribed, they are administered in accordance with the prescription or not. So the nurse notes, we can find that a nurse will document that the particular drug which was prescribed was administered at particular time. So you can check in par with that of the prescription and the nurse notes, whether they are in par with each other. And computerized monitoring. Now, in developed countries like US and UK, and even in most of the states in India, computerized order prescription entry is what is implemented, and this helps a lot in identifying your medication errors, including the drug interactions, etc. Once the prescription was computerized, and especially it should be given in a the prescription should be given in the generic names, not the brand names. So when a doctor prescribes a prescription with the generic names, then you can easily identify any overdose, underdose, or any missing values, or if there is any erroneously it was done. So computerized prescription order first eliminates the illegible writing, or improper prescription or notations, etc. So, which is the main reason behind the prescription errors. So, the illegible writing or using of abbreviations or terminologies which are not approved, Such kind of process can be eliminated by computerizing. And another advantage is we can identify the drug interactions and also the medication errors like overdose, underdose, and of course any other prescription errors can be identified by computerized prescription order entry. Now, administrative database, using these administrative databases, uh, in America, US, you have something called as a clinical claims database. Now, this claims database of National Institute of Health, the main advantage is using claims database. It collects the information from different hospitals around all the hospitals in US in a real time mode. So a doctor who prescribes a medicines, so the doctor's notes will be documented in the claims database at the same time, in the real time. And this database helps for the researchers to conduct a research, and they can statistically analyze the data, okay, from different hospitals. So it will be stored, and you can identify, one can identify what kind of errors is happening, and what is the burden the medication errors are causing with related to financial terms and also in related to the patient suffering. So this is about the claims database. And of course, standard procedures like direct observation, incident reporting, and patient monitoring also helps in detection of your medication errors. So direct observation is the sense during the ward rounds and during the so the clinical pharmacist can easily identify the medication errors by reviewing the treatment chart and of course the incident reporting and while monitoring the patients for their health status. So on daily basis, the patient should be monitored for the development of adverse reaction or adverse events. And if the event has occurred, we have to make a develop a causality relationship. What is the cause for that particular event? Is that a medication error that is responsible for that adverse event, or it is a drug which is directly causing adverse event? Okay, so it is very much important to analyze the adverse event is a medication error or it is due to a particular drug. Once it is confirmed that the adverse event is due to the drug, then it is an adverse drug reaction. And if it is identified that the adverse event is due to erroneous administration or erroneous dispensing, then you can classify it as a medication error. So there is a thin hairline difference between medication error and adverse drug reaction, to which adverse event is a common finding. Now, let us see the safe medication administration processes by which, by implementing by which you can, clinical pharmacist can reduce the medication errors. Now, there are seven parts or seven steps, you can say, how the safe medication administration can be implemented. First of all medication orders, either it may be a written order or a verbal order, they should contain patient's initials or the name or with the unique identity number or IP number, inpatient number. It should also include date and time of the order, name of the drug, especially in the generic name, dosage form and dose, route of administration, whether it is a per oral administration, IV, IM, frequency of administration, whether it is once daily, twice daily, or thrice daily. Now, prescriber's name and licensor, who has prescribed the, so always the prescription should be signed by the doctor, and of course, the licensure number should be mentioned on the prescription. Now, if the clinical pharmacist ensures that the medication order contains all these seven parts, then the most of the errors can be minimized. Now, coming to the prescription, yes, the prescription should be prescribed by a legally qualified physician who is professionally competent and licensed. Now, prescription must have only must have the authority to prescribe a prescription. No other healthcare professionals are entitled to prescribe apart from the physicians. Telephonic orders, while receiving telephonic orders, you should be a very good communicator, or oral communication should be very good. You have to ascertain and confirm the order twice, and also by reading it back you can do that. By receiving, for receiving telephone, and for by receiving verbal orders, you can repeat the verbal order, and do a double check by verifying all the verbal orders for accuracy. So this is how the clinical pharmacist can perform in the ward rounds for preventing the medication errors. Coming to the actual role of clinical pharmacist, now clinical pharmacists and nurses do play a major role or the key role in preventing medication errors, and clinical pharmacist should play a major role by checking the medication errors in each and every steps, that is while prescribing, while dispensing, while compounding, and also the administration. But nurses are confined only to the medication errors. Nurses will know what error they have committed during administration of a medication. So, in spite of knowing this, most of the healthcare professionals, nurses, will not report the medication error because of a fear that there may be a legal action, or there may be an action taken by the physician or the hospital authority against her. So any healthcare professional who commit that particular error, make sure that the error is underreported, is not reported, and of course, and also they will not make certain prevent. They will not look for the solution for the error that has happened, and this will affect or harm the patient inadvertently, and this is the reason why patients end up in admitting in the hospital. Now, clinical pharmacists, apart from the medication error, administration errors, they have to look for the dispensing errors and prescribing errors. They have to check for the prescription accuracy and identify all the drug-related problems, if any. They have to review the treatment chart in conjunction with the nurse. This was already discussed in my last slide. You have to monitor the patient health status periodically, and they have to observe for the development any adverse events. Now, healthcare practitioners, of course, nurses, are who are in the administration role. The majority of errors will reach the patient during the administration stage, and nurse is held liable for most of the errors which occur in the medication settings. Now, one has to verify whether the drug is safely administered, and whether the order which was given by the physician is without any errors, and you have to check whether you are using a reliable drug references to make an intervention. Suppose you identified that clinical pharmacist identified there is the drug was erroneously prescribed. Either may be the route of administration, either may be the dose or dosage form, whatever it is. One has to go with the reliable drug references, and once you are happy with the amount of reference you got for an intervention, now this is an opportunity for the clinical pharmacist to make an intervention with the supported references. Then you can intervene. You can discuss with the healthcare professional, concerned healthcare professionals. Then you can implement the change, whatever the suggestion you have given. Okay. So once this was done, once the intervention is accepted, then definitely you have to monitor the patient's health status after the intervention or after the drug change or suggestion is accepted. Now, maintaining a good rapport and also the interprofessional relationships with all healthcare professionals is also very much important. So, not only for the clinical pharmacist, but also for the other healthcare professionals. Interprofessional relationships is very much important for an effective communication and effective good understanding. Now, another step is the role of people in the clinical pharmacists to implement safe medication practices. For example, error-prone abbreviations should be avoided in the medication records. For example, for this, instead of using mu for the micrograms, mu, it will be represented like m. Okay, so mu and m are look-alike. So if you use such kind of abbreviations in the medical records, so there will be a misread. So it will be misread as mg instead of μg. Instead of micrograms, they may administer milligrams. So it may be an overdose for the patient. So such kind of abbreviations, which has the potential to cause an error or to cause a harm, then we should be identified. And instead of mu g, you have to write clearly as micrograms. Okay, or it is an mg, right, as a milligram. Okay, and unsafe acronyms, medical terminologies, signs and symbols should be avoided at any cost because it is not a safe medication practice. Now, one has to remember 6 rights for the safe medication administration. I think many of you will be aware of this. Firstly, they have, I think in 2010, when I studied, there are 5 rights for safe medication administration. Now it has come to another level where 6 rights for safe medication, and even some books have quoted 7 rights for safe medication. Nevertheless, whatever it may be, the 6 rights include the right patient, right drug, right dosage, right route of administration, right frequency, at right time, and the sixth one is, of course, the right documentation practice. It's very, very important. Now, of course, the medication should be given to the right patient at the right time, and a right drug should be given at a right dosage and right route of administration, and of course, the frequency. And the sixth right is the right documentation practice, where whatever process was happened, that should be documented in the case notes. So if an event has occurred or patient has complained that the patient is having some discomfort, that event should be documented in the case notes. And also, when the drug is administered, or if it is not administered, whatever it may be, the nurse has to document in the nursing notes regarding whether the drug has administered or not administered, and the reason why it was not administered in case. Okay, so this is known as good documentation practice. So right documentation practice is also one of the safe medication administration's uh, rights. Okay, so these are the 6 rights one has to keep in mind. Especially the clinical pharmacy should be aware of these 6 rights, and make sure that these 6 rights should be implemented in their healthcare settings. Now, encouraging the healthcare professionals to report medication errors apart from the adverse drug reactions should be done, and especially the clinical pharmacists should take a lead or initiative in conducting continuous professional development programs for detection and reporting of medication errors. And here I would like to add a point where in developed countries, they for prevention of errors, error prevention is can be planned by means of retroactive and proactive tools, like implementing an method known as failure mode effect analysis, criticality analysis, and also by conducting audits. Audits is everyone is aware of what an audit is. So whenever an audit is conducted, lot of errors will be identified during the audits. But as it is as we are going retrospectively auditing all the things which were happened, even though when you identify the medication errors, there's nothing much to do to overcome or to prevent or to uh, uh, minimize that particular error during the audits. But the method which is known as FMECA, that is failure mode effect criticality analysis, this is a analysis which believes that errors do happen. Okay, no one can avoid it, even though you adopt a computerized prescription order or a barcode system or electronic medication administration records, whatever it is. Even though you use very sophisticated instruments or methods, error to error is human. So errors do happen, and that is considered as a failure mode. Now, for this mail failure mode, we have to critically analyze these failures and uh, modify them or try to correct those particular failures. Okay, so uh, if the time permits, I will discuss this method of FMECA, that is failure mode effect and criticality analysis, after completion of my presentation. Okay, for audience, if you require much information regarding this process, then with a suitable example, I will definitely discuss at the end of the presentation. Now, audits, yes, very much known, which is an educational activity that promotes high quality care, of course. And monitoring and audits are a cyclic process. Periodically we have to plan the audits, and to which are helpful in identifying, and of course immediate corrective actions cannot be possible, but in future we can place a corrective action, and we should make sure that in future the similar kind of incidents do not happen, okay, during the audits. Now, I would like to share with you the Joint Commission patient safety goals. So I have given the source here. The Joint Commission patients issues certain guidelines for the patient safety goals. So since it is very much Joint Commission since 1951, it is the most reliable source where it issues the guidelines, and almost 22,000 hospitals and organizations are accredited by this Joint Commission in USA, and it has introduced patient safety goals and uh, a safer practice for the healthcare professionals. And let us see some of the patient safety goals which should be implemented in every healthcare system in order to prevent the medication errors, and not only medication errors, also the adverse drug reactions and other errors. Now, firstly, the Joint Commission goals include identifying patient safety dangers and risks. One has to identify how safe the medications and etc. Are going for the patient. Is the treatment is what was given was safe, and what are the dangers and risks the patient poses? What are the comorbidities, or what are the different kind of medications the patient is taking? And risk. So risk assessment analysis should be done for each and every patient, and individualization of prescribed prescription or therapy is what the key in identifying patient safety. And once identify patients correctly by confirming the identity of the patient in two ways. So we obviously identify the patient by the patient's name, but that sometimes we may end up in identifying a wrong patient, where two patients may have a same name. Now, another way of identifying a patient is by his or her inpatient number or unique identification number, right? So you should always go with two ways for at least two ways for identifying the patient. So confirming the identity of the patient, should be done in at least in two ways, either by the name, either by the IP number, or also by the patient's ward, and of course patient's history, etc., confirming those. Now you have to one has to improve the communication, such as getting the test results to the correct patient quickly, and also of course uh, certain procedures like perfect infection by prevent infection by hand cleaning. Of course, in COVID, it's very important to have sanitized hands, and of course, you should prevent for preventing the infection from spreading from one patient to another patient. So we have learned a lot during this pandemic regarding these patient safety goals. We have to prevent mistakes in the surgeries when patients are in the OP, and make sure that the correct surgery, the right surgery is done at the right body part and to the right patient, and etc. You have to double check whether this is the patient to which the surgery has to be done. Okay, and detect, use the device alarms, or make sure that alarms on the medical equipment are heard and clear checked quickly. Okay, so these are the different goals, and for the use of medications correctly and safety, one has to double check the labeling, and also correctly passing the onto the patient's medications to the next providers. Okay, so especially with the nurse who maintain a flow stock, where they maintain a stock of medications in their particular nursing units. Okay, so during the change of the duty, when the night nurse comes in and the day nurse goes off, then the night nurse should check with the medications, whatever the medications which are used, and how the the usage record, and of course the patients with the how the drugs were administered to which patient, etc. She has to make sure that she know all the information regarding this. Now coming to the labeling, all drugs should be labeled correctly. If there is any error in the labeling, then of course it may lead to administration error. So it is a direct potential for causing an error if there is an error in the labeling. And of course, we have to spend extra time with the patient, counsel them how to take the medication, especially the patients who are about to discharge and who are prescribed with the narrow therapeutic index drug or high risk drugs like anticoagulants and chemotherapeutic agents. Now, anticoagulants, if there is any overdose, the patient may end up with internal bleeding. Okay, so anticoagulants like apixaban or dabigatran, then warfarin. So regular monitoring for the patients with the prothrombin time and INR, international normalizing ratio, is routinely done for these patients. So one has to check with the uh, monitor the levels of the drugs, and also with respect to chemotherapeutic agents. So patients should be made aware regarding those, how to use the medications, and when to and when in doubt, you have to contact the clinical pharmacist or the doctor immediately. And also when they develop any adverse events, then immediately you have to communicate to the healthcare professionals. The primary contact should be the physician and the pharmacist, where only these two people can reduce or help the patient to in solving that particular problem. And of course, to prevent the nosocomial infections or hospital acquired infections, hand washing should be done routinely and after visiting each patient. So this is a generalized procedures what was given by the National Commission for the patient safety goals. Now, in these patient safety goals issued by the Joint Commission, we have learned how to improve the patient safety by identifying the potential threats and risks, by identifying the whether the patient the medicine was given correctly to the patient, how to identify patient, then improve the communication, and also how to prevent the spreading of certain infections and etc. Double checking the medication orders, ensuring that particular medication or the particular surgery is done to that patient and at the right body part, etc. Okay, then how to double check and how to correctly pass the medication to the one patient to another patient, and also between the healthcare professionals. Labeling of the medications is also important in preventing the errors. Okay, and also of course spending extra time with the patients who are on polypharmacy and also who are on high risk drugs like anticoagulants, chemotherapeutic agents. Now coming to the medication error steps for prevention. So these computerized systems, especially I already spoken regarding this CPOE, which stands for computerized physician order entry. It avoids illegible prescription first, and also we have an extra advantage that immediately the drug interactions and medication errors can be identified because they are displayed, and each and every healthcare professional has the opportunity to look at the computerized prescription order. And of course the electronic medication administration records, especially nurses will document the administration process. Okay, and she can immediately retrieve the information whatever that is documented electronically by them. So this is electronic medication administration record is in the is the responsibility for the of the nursing staff, where nurse will directly document the nursing notes in this EMAR. This avoids medication administration errors that are usually a nursing staff do. And also implementing barcoding system, where the barcoding system whenever a patient is admitted, a barcode will be given to the patient, and whenever the barcode scanners were placed, the barcode is read and the patient data will be directly connected to the laptops, and patient data can be retrieved easily into the laptops. So all these computerized systems should be adopted in every healthcare system in order to minimize and prevent medication errors. And of course, the healthcare organizations need to establish a very good environment and culture such that the healthcare professionals can focus on the system improvement. Okay, and also of course they have to have only a specific goal, like medication errors should be minimized, and this is a challenge for every healthcare professional. So medication errors should be taken as a challenge that must be it must be overcome. Okay, so this is how the healthcare organizations and the hospital managements can establish a culture within their medical team, such that everyone can focus on identifying, then discussing, then how to minimize that particular, instead of blaming each other. So whenever a nurse or a pharmacist or of course a physician has committed an error, now if all other healthcare professionals start blaming, then shaming, and of course when the hospital management gives a punishment to that particular healthcare professional, that will not create a good culture or a good environment. And that is the reason where in future they underreport the medication errors. So we have to develop and maintain a good culture and interprofessional relationships, such that we have to work towards recognizing the safety challenges and implement the solutions. Now each and every healthcare professional should take it as a challenge that yes, medication error has occurred. Now the whole team should work how to prevent the error, or how to what is the solution for that particular error, okay, that has reached the patient. Okay, so this will really help the patient and also maintains a good environment within the healthcare professionals. And unfortunately in most of the countries or most of the hospital settings that is not happening. Now, all healthcare professionals must play a role, not a single individual. As I told you, all the individuals in the healthcare team must play a role, and you have to for the safer healthcare. And of course, the solution lies in recognizing the safety challenges and also in implementing the viable solutions. Now, identifying an error, then analyzing the error, and also the implementing solutions for that particular error is very much important. Now, government, legal and medical institutions also must be collaboratively work, and they have to understand that the error which was happened and led to a potential harm is not an intentional one. Errors do happen in the system, and the government or other hospital management should not what you call promote a culture of blame. Okay, and while retaining the accountability, so they have to understand that the errors may do happen frequently, and we have to work in such a way that it is prevented first, in the first place. And when the error usually happen, then you look for the solution. The whole team and whole hospital management should be in supportive of that. Okay, now this is all regarding how the errors can be identified stepwise. Now, pharmacists and nurses should stock lookalike medications differently, away from each other, and which were, of course, those medications which are having a high risk, especially with that of anticoagulants and chemotherapy agents, and also those which are having lesser therapeutic index, they should be stocked separately. And lookalike medications, of course, we have to reduce those things by grouping those drugs, not by the order what they do by the cat, instead of alphabetical order. They have to be stored by the uh, pharmacology, that is nothing but the class of a drug. So anticoagulants, all should be kept in one under one roof. Then antihypertensives and so on, instead of alphabetical order, A, B, C, D, and etc. Now coming to the computer-based forms, which were already discussed, like CPOA and etc., they should be available for parental nutrition orders, especially for parental nutrition orders. The computer-based system should be adopted. Now, the pharmacist should move to dangerous medications when managing with those from flow stock. So they have to discard the out of date medications, expired date medications, and they have to maintain that those medications which are well within the expiry. Okay, and oral liquids, of course, should be always be dispensed in unit packed dosages, not in multiple ones. And concentrated electrolytes should not be on patient care units. So because electrolyte imbalances can happen, so concentrated electrolytes should not be stored on the patient care units. So these are the preventive steps that can be taken. And first do no harm, of course, is the uh, which was given by the Hippocrates. So in healthcare system, even though you don't provide medication care and heal the patient, first do no harm is the concept. But of course, in the process of providing good care, medication errors do happen, and medication errors lead to significant morbidity, mortality, and increased healthcare costs. That is around $4 billion US dollars per year. And of course, errors are all preventable. Errors do occur, but I should correct the statement where most of the researchers and books, they just write that medication errors are 100% preventable. But according to me, medication errors are not 100% preventable. They do occur. But what we can do is we can stop the errors reaching to the patient. The errors which was occurred at the prescription level, or errors which occur at the dispensing level, that can be stopped by reaching the patient, and that is 100% preventable. So you can prevent the errors reaching the patient. So that is 100% preventable, but not the errors to happen. Errors do happen, but it is can be 100% preventable from reaching the patient. So this is what my understanding and my perception. I think you people agree with me. And implementing computerized systems like CPOE and electronic medication administration records is also very much important in every healthcare system to have these computerized, which will minimize the prescription errors and dispensing errors, and also the administration errors to a maximum extent. And to stress, pharmacists and nursing staff play a key role in preventing medication errors. Nursing staff, I told you that they are confined to only administration role, so they will be identifying only errors. But pharmacists will identify the errors at all the steps. And of course, we have to clarify provide to administration when the order is unclear. So whenever you receive an order and you don't understand, or the handwriting, or you don't understand, so whenever the clarification is necessary, okay, then you have to again go to the doctor, concerned doctor who prescribed, and sort for the clarification. Instead of administering it erroneously, you have to seek for the clarifications. And underreporting is very much present, and it's of a major concern. And reasons behind underreporting I already discussed. Okay. And all the healthcare professionals need to work together, and those who committed medication errors should not be blamed or punished. Okay. And instead, all the healthcare professionals should try to find a solution for that particular error which was happened, and take necessary steps such that the so into particular error is not repeated in the future. Even the best clinicians make mistakes, so therefore every practitioner should be encouraged, okay, and supported by the colleagues. And clinical pharmacists are the last line of defense between a safe and unsafe medication administration. So these clinical pharmacists are like antivirus to the system. So whenever there is an potential threat with respect to medications, or with respect to any other administration procedures, or any of the errors, it will be clinical pharmacists should be in a position to scan those, to identify those potential errors, identify those potential drug related problems, identify those potential adverse events, and make intervention and contribute for better healthcare professional outcomes. So with these conclusive points or take home points, I would like to conclude this session. And thank you so much for the organizers for having me here. And thank you, the audience and the participants, for your patience listening. So, Dharani ma'am,
Yes, sir.
so
Sir,
it's
there
a
is a query
thank
from
you, I
delegates,
think
sir.
so, ma'am.
Sir, there is a query from our delegates.
Yes, yes.
Sir, if you can you see it on the screen, sir? If you close the screen, you can see it.
Yeah, yeah. I just closed it. Yeah, I can see this. What is the importance of barcode medication administration in medication error cells? That's a very good question from Jagruti Reddy. See, barcodes which were implemented. So whenever the patient is got admitted in the hospital, the data. See, most of the errors happen by transcription errors. I think you are aware of the transcription errors. So whenever you copy the data, which is in the treatment chart, you will copy that same notes in your patient profile form, right? While we go for ward rounds, what we do, we just copy the data which is present on the medication records on your profile notes or your textbooks or your notes, right? So there is an every chance that you copy that erroneously. So this is known as a transcription error, right? Now this can be avoided by implementing this barcode system, such that once the data which is entered when the patient joined the hospital, admitted in the hospital, the data which was collected and it was maintained by the hospital computers. The same data will be scanned at different levels, like whenever the patient was taken for the diagnostic procedures, whenever the patient was taken for any other pharmacy or any other surgery, whatever it may be, all those departments will scan the barcode and they will get the data which was initially documented in the hospital database, instead of copying it each and every time, which is a laborious and tedious process. So barcoding system will definitely going to help the hospital procedures to happen in a faster manner. It avoids the process of documentation, and also the transcription errors while copying also minimized by using barcode system. I think that helps.
That was a delightful session, sir. Thank you so much, sir, for giving us insights on preventive steps to reduce medication errors. We are extremely honored to have you, sir. Thank you for being a part of this webinar.
Yeah, thank you so much. And I would like to thank Chairman Sir Jaipal Reddy Garu and Principal Sir and organizers of this webinar for having me here, and also all the participants who patiently listened this particular webinar. And I hope I've done justice for the topic which was given to me. I thought it was bit exhaustive, and within the time slot, I think I have completed my session. And thank you so much, Dharni Madam, for having me here. And thank you.
Now let's move on to our third session. I would request Ms. Shivani Raula, Assistant Professor, St. Peter's Institute of Pharmaceutical Sciences, to introduce our next speaker, Dr. Avinash D. Kadela.
A very good afternoon to all. I'm glad to introduce Dr. Avinash D. Kadela, who is our next resource person of our today's session. Dr. Avinash, working as an assistant professor, Department of Pharmacology and Pharmacy Practice from February 2021 at Maliba Pharmacy College, Tarsadia University, Gujarat. He completed his PhD Oncology Pharmacy Practice from Ukka Tarsadia University. Dr. Avinash did PG Diploma in Pharmacovigilance from JSS Academy of Higher Education and Research, Karnataka. He did his MPharm from Pharmacy Practice from JSS Academy of Higher Education and Research, Karnataka in 2015. Dr. Avinash received 1.1 lakh INR grant from state government funding agency Gujarat Cost to organize workshop for pharmacy and pharmacy practice undergraduate student for continuous education development. He is a recipient of gold medal for obtaining highest marks in pharmacy practice in Master of Pharmacy by JSS University, Mysuru. He actively participated in national and international seminars, been awarded for his presentation. To his credit, he has published 9 publications in reputed journals like International Journal of Clinical Pharmacy, Journal of Oncology, Pharmacy Practice. Is going to have a session on the topic medication errors, humanistic and economic impact. I would invite Dr. Avinash D. Kadela to start the session.
Well, thank you so much, Shivani ma'am, for your kind introduction. And I would like to convey my sincere gratitude to the St. Peter director, chairman, principal, as well as the all organizers of this webinar. Apart from that, I would like to thank Dr. Dharni ma'am for the good opportunity so that I can speak or I can share my knowledge regarding on the medication error and its humanistic and economic impact. And I also like to thank Manushri, my one of my good friend. So she asked me that whether I can be a speaker for this session. So definitely I would be sharing my thought and my knowledge with the students in a different perspective. I can understand that this is a lunch time, so everyone is hungry and wanted to have a lunch or grab a lunch. But we make sure that I will keep my session very crisp and concise and precise, so that you will learn and I will finish it within a short time frame. So coming to the presentation, Is it visible, ma'am? Dharni, ma'am?
Yes, sir. Yes, sir. It is visible.
Thank you. Yeah, so I'm going to discuss about medication error, its humanistic and economic impact. Now, this topic is a little bit different because whenever we talk about medication error, we generally talk about something which have some direct or indirect clinical impact. Because in the health setup, like developing nations and in some developing nations also, majority of the focus would be of a clinical outcome that once patient will come to the hospital, the focus would be to treat the patient clinically, and the less focus was kept on humanistic and economic impact. But at the same time, in order to understand that a simple kind of a medication error has negatively impacted on a patient quality of life and also economically, because the cost of therapy is indirectly increasing. So I would like to discuss the point which is helping us clinical pharmacists to share the impact related to the patient on the health related quality of life. Apart from that, their economic consequences. If an error is occurring, it is leading to some nauseous or unwanted effect, and this nauseous and unwanted effect is definitely affecting the clinical outcome, which is of a major concern of a clinician or treating person. But at the same time, the suffering is also affecting, or because of that suffering and because of the error, the cost behind the therapy is also increasing. Ultimately, it is also affecting to the government of a nations, because the healthcare expenditure behind patient care is also increasing. So that is why I have kept this point, because everyone in the curriculum also have some of the idea related to medication error, what types of medication error they may be having, or how to prevent it, what is the role of clinical pharmacist.
Excuse me, sir.
But the yes,
Can you move
yes,
the
ma'am.
slides? I can only see the first slide.
Yeah, is it visible?
Yes, sir. Now it is moving.
Okay. So
Okay.
I have kept the plus side just for the introduction purpose.
Okay, sir. Okay.
Yeah.
Continue, sir.
Yeah. So when we talk about humanistic and economic impact, we try to convey to the hospitals that when the error is prevented, it is not only benefited for the clinician, but it is also benefited to the patient, in not in terms of only cost saving and decreasing the days of hospitalization or minimizing the uh, uh, cost, but it is also affecting at the patient satisfaction level also. So moving to the presentation would be included of definition. Definitely, you all have already studied the definition, and Professor P.K. Lakshmi and Professor K.S. Arun Kumar have already discussed so many points. So I don't discuss much in detail about this topic, and would mainly focus on the humanistic and economic impact. So we will covering very briefly a definition, epidemiology, very important, because we have to understand that this burden of medication error and the consequences which this medication error is causing is very troublesome, and we can highlight those points so that we can prevent it. The purpose of focusing on humanistic and economic impact is just to prevent the possible events so that we can help the patient, and we can more focus on the pharmaceutical care concept. It is an evolving concept where the individualized pharmaceutical care is focused by all the healthcare practitioner nowadays in this 21st century, thanks to all the evolution in the medical science, that we now try to provide individualized plan so that we can help the patient to recover fast, efficiently, and with the minimum cost, and also make sure that the suffering is also considered, because all the times patient suffering, patient feeling about the management, how they feel about the treatment provided, how they are recovering. Maybe sometimes clinical outcome shows patient recovered, but patient doesn't have physical as well as mental wellness. So this is very important for us to understand and make sure that patient also feels better humanistically, along with the clinical efficiently outcome. Then we'll discuss about the classification very crisp. I will give you 2 or 3 examples so that you can understand that when the error occurs, how it impact or hamper the quality of life of the patient. Apart from that, how it hampers the economic outcome. And lastly, I have tried to kept both the outcome together so that we can discuss about a humanistic combination of humanistic as well as economic outcome in terms of some health economics concept. And lastly, I'll conclude my session with brief overview. So starting with the definition, already the two speakers have said that it is a preventable event. So definitely medication error is preventable, but as Professor Arun Kumar said, it is medication error will always occur, but we can avoid or we can prevent this error reaching to the patient. Definitely that is the concept we should inculcate in our mind, that error can occur at any time after 10 years, 20 years, 50 years, when the health care setup will flourish, but definitely error will occur. But we at our level should try best to prevent those errors, and definitely these errors are preventable in terms of reaching to the patient, and it always lead to some inappropriate medication use. Now pharmaceutical care, again I'm quoting that pharmaceutical care is focused on appropriate medication or rational medication. I should use the word rational medication, because not only appropriate medication, but whenever we talk that the medication should be prescribed, it same medication, the rational medication prescribed, should reach to the patient in the appropriate manner. And error occurs from one point to the last point, that is prescription to the administration. So maybe there will be a problem related to writing of the medication, and maybe there is a problem related to dispensing of the medication, and maybe there will be a problem related to administration. And this is the process where all healthcare practitioners are involved. We have to educate all of them. Majority of the time focus is on educating the nurses, educating the pharmacists, but the dispensing pharmacists, community pharmacists, everything we have to take into the consideration. Generally people are discussing about medication error in inpatient setup, but the less focus is made on the outpatient, because we don't have direct control on the patient who are not admitted to the hospital. But definitely we can also set up a system where there should be some kind of a monitoring parameter which can also focus on the prevention of error in the outpatient setup. So the medication error, definitely it is a preventable error. It is leading to the consequences like preventable as well as sometimes non-harmful preventable medication error. So preventable medication error, again, because of medication error, if some patient had any kind of adverse event, maybe it is harmful, maybe it is not harmful, but the error occurred. So we have to make sure that this error, whether leads to harmful or non-harmful adverse event, we have to prevent it, because maybe in that patient it is not harmful, in another patient, when we talk about individualistic plan, it may be harmful. So any error if occurred should not be neglected, and we can try to prevent it. Considering the epidemiology of medication error, this data is very shocking, but it is true that 42 billion US dollar each year is spent behind this medication error. Because of this medication error, the burden of the healthcare cost is increased by 42 billion US dollar. This is a huge sum of amount. And this medication error, maybe whatever we have came across to the medication error, maybe it is very small at your point of view, but the longer view of that medication error, when you discuss about humanistic concept, it will lead to consider an economic concept. I will discuss it later on, that direct, indirect and intangible cost, it is a huge sum, will be affected. And this medication error leads to adverse drug reactions, and these reactions lead to adverse drug event. And the event when occurs, it is having a disaster for any patient, because so many things will be involved: managing that adverse drug reaction and event, recovering from that adverse drug reaction, and then treating the existing condition, pre-existing condition, delaying the therapy, delaying the particular treatment for the disease which already which for which patient has admitted to the hospital or maybe visited to the hospital in outpatient department, is affecting very much in terms of all three perspective: clinical, humanistic, and economic. So I will just briefly go through the classification of the medication error. Mainly, I classify medication error into three, and then there is a sub division of a medication error as per the American Society of Health System Pharmacists: prescribing, dispensing, and administration error. Now, at this three point of view, if I want to say prescribing error, mainly because of the registered healthcare practitioner, maybe illegible writings, or maybe in the high, because in India or some developing nation, the patient physician ratio is very low, because we don't have much good physicians available, so that there is a high patient load every time in the OPD or in inpatient. So maybe in a hurry, maybe because of some other important task, there will be an error. So prescribing error occurs at the physician level. Considering the dispensing error, because again the dispensing error occurs at the time of dispensing the medicine. Nowadays we don't have to prepare medicine, just pre-filled medicines are available, we can dispense it. But at the same time, lack of knowledge and skill may be leading to this kind of errors. And sometimes I don't know whether you are aware or not, but in pediatric there should be a dose division. So dispensing pharmacists should be asked for the dose division. A clinical pharmacist definitely can help, but dispensing pharmacists should divide the dose because of that age and weight in the pediatric population. Again, there is a chance of error because of so many reasons. So that also contribute to the medication error. And lastly, administration error. This is a huge uh, this is having a huge impact on the medication error when we consider, because administration done by the nursing unit, maybe they are not much aware about the therapeutic concept of the drug, and because of that negligency, they can end up with the having administrating type of error. Maybe if I say in oncology, it is very huge error if a nurse is not well trained. There may be a chance of death of the patient because of the minor negligence. So I will try to give an example later on when we discuss about the different types of source of medication error. So coming to the source of medication error, just few of the example I have taken so that I can explain. This error leads to uh, increasing in the human suffering, as well as increasing in the total medical cost spent by the patient. So first is very simple error I have kept here: incorrect transcription. So obviously in the all hospital there is a transcribing error, and they are also reporting it. So whenever they are transferring the prescription from one point of view to the second, for example, when the hospital doctor visit the inpatient department, a doctor says that okay, this patient should start with XYZ medication, and the nurse or maybe the interns along with the doctor may write it. But because of improper or improper hearing, maybe a person who is writing make a mistake, and because they are in a hurry, or maybe sometimes they feel some inferiority complex, they don't verify with the doctor, so there will be a chance of error. Apart from that, nowadays I can say there is a very digitalized area. Barcode system is available in all the hospital. Once the patient entered to the hospital, a barcode is given, the number is given, unique ID is given to the patient. So wherever a patient goes, the same data would be stored. But at the same time, sometime while generating a barcode also there will be a problem. So this kind of error occurs at the level of transcription. Then mix up of patient. This is a very important error if we want to discuss, because distraction and interruption occurs at any time and all. I can say all the time in the hospital, because we say that hospitals are flooded with the patient nowadays because of this COVID also, and majority of the hospital, if it is having a good reputation, they are flooded with the hospital. Maybe sometimes lack of staff, lack of training, lack of knowledge. They may be having some other work to do or finish the task on time. Maybe they are distracted or interrupted, and they may forget that I have already given the X drug to the patient. Maybe they end up with giving another drug, another dose. And the purpose of giving a drug by the nurse is to make sure that optimum drug and optimum dose should be administered. But sometimes due to this kind of distraction interruption, they end up with the overdose, or sometime no dose would be given. So this is also leading to some serious kind of medication error. Then mixing the medication, this is very important. Sometime medication would mix up because of night, at night time when the nurses are doing their work and they don't want to disturb the patient, they switch off the light, and maybe because of that reason, maybe they cannot read properly the labeling, and the error can occur. This is same thing occurs with the lasa medications, lookalike sound alike medication. Sometimes because of the similar count of pronunciation or similar kind of spellings, maybe there is a error already discussed by the uh, other speakers, so I'm not going to much detail. But this kind of errors, if are in the narrow therapeutic index or non-linear pharmacokinetic drug occurs, lethal side effect, lethal adverse drug reaction, and maybe adverse event can occur, and that is leading to so many consequences in terms of clinical, humanistic, and economic. Now, insufficient mixing of ingredient. This I have seen so many times. For example, if I give a simple example of pantoprazole, you may be all aware about pantoprazole, which is used for inpatient to avoid gastric disturbance. So it is available in the form of powder, and along with that powder vial, there will be availability of a water for injection. So, because there may be an error in filling the syringe from that particular water for injection, or maybe leakage, or maybe due to some error, they are not emptying, or they are not putting all the sterile water for injection into that particular vial. And because of insufficient diluent present, the insufficient mixing of pantoprazole occurs, and when it is administered to the patient, maybe patient have any kind of anaphylactic reaction sometimes because of the solid particle, or maybe it get clogged, or it can lead to site infection. Maybe so many consequences will occur. So this is very important for nursing staff to understand, because they are administering this drug, that proper dilution is required. And that is why pharmaceutical company has given you 10 ml or 15 ml of waterfall injection for that particular medicine. So this is very important, and that is why it is important to educate nursing unit to prevent this kind of error. Otherwise, it is not possible just to pointing out that this is the error will not work. Just we have to educate them that how can prevent these kind of errors. Then incompatibilities due to difference in pH, there will be some incompatibility when mixing the drug. Mixing the drugs basically important task in the cancer patient, because in cancer we give chemotherapy in the dilution form, because we cannot give direct injection of cisplatin or paclitaxel. It leads to toxicity. You know that anti-cancer drugs are very toxic. So it should be diluted with a normal saline or ringal lactate or dextrose in normal saline, and then it should be given in the form of infusion. But when we mix the drug with the IVF, intravenous fluid, we have to make sure that we can check the pH and the compatibility. If it is incompatible and we mix it, high chance of anaphylactic reaction and death of the patient will occur. So this is a major consequences when we talk about medication error. Apart from that, there are so many reasons. I am not going much into the detail because I would like to cover the humanistic concern and how to measure it. Use of inappropriate diluents, contamination of solution, incorrect infusion rate, already discussed by the sir as well as madam, that once the infusion rate increased or decreased than the normal, it will lead to so many disastrous effects. Mistake in calculating drug concentration. This occurs in pediatric population when the dose division, and this also occur in the renal failure patient and liver failure patient, where the dose adjustment is required. So maybe if we'll not consider GFR before prescribing a dose or medicine, this kind of error can occur. Incorrect or missing labeling of solutions may also lead to consequences. Now, moving toward the main topic of today's that I would like to discuss about the consequences. Now, what are the consequences of medication error? So, obviously, medication error leads to so many clinical, humanistic, and economic hampering, but how it is doing it. So, I have tried to categorize as per the humanistic, economic, and clinical concern. When the errors occur, no doubt there will be so many other consequences, but the patient suffering is increasing. And when the patient suffering is increasing, it increases in terms of physical as well as mental stress, because no one likes to admitted in the hospital. They want to get out of the hospital as soon as possible. Maybe their therapy requires 5 days, but if error occurs, the therapy will be the length of the hospitalization will increase from 5 days to 7 days. And obviously, hospital is not our home, so they are charging us. And because we are staying there for more or longer period of time, we not only suffer, but we also have to pay for that particular event. So, patient suffering is a humanistic concern. It is because of medication error, mental, physical stress increases not only of patient. We also have to think about caretaker. In India, we are very much attached with each other. So obviously, when the patient suffers, the relatives will also suffer, and they also have to stay back to the hospital, and their wages will be also lost. So if we consider these many factors, definitely this is a very huge concern if the medication error occurs. Apart from that, economic concern, the hospital stay will increase. So definitely the hospital stay increase, we have to pay more charges. Patient has to pay more charges for that. Hospitalization cost will increase, and because of that error, whatever mistakes happen, the treatment to cure or to come over from that particular disaster is also affected to the patient. So that is direct medical cost. If some adverse drug reaction occurs due to medication error, the treatment of that medication error also takes some uh, cost. So that is also we have to consider when we discuss about economic concern. Longer duration of therapy, this is a clinical concern, because therapy is effective for some disease, and that will be stating that patient will recover in 5 days, but because of error, patient will recover in 9 days. It is not because of the problem in therapy, it is because of the problem in the it is because of there is some error occurred before the drug is prescribed rationally to the patient. And managing these adverse drug reaction and events are always costlier. So these are the main consequences of medication error if we look into the consideration. Now, moving back to the humanistic outcome, what is humanistic outcome and how humanistic impact or this medication error occurs, which affect the patient humanistically. So it is a patient reported outcome. Generally, the focus is related to sign and symptom. Simple. If someone comes to the hospital, patient reports some of the suffering, doctor do some test, so the sign and symptoms will be getted, and symptomatically patient is treated, and also patient is treated in terms of particular pre-existing or existing condition. But it is not true that after completion of the therapy, patient, from patient point of view, patient completely recover. So how we can cross verify that clinical outcome has matched with the humanistic outcome? Definitely for that, patient reported outcome is important. What is the perspective of patient? What is the opinion of patient related to medication prescribed, related to therapy given? I'm talking about satisfaction. They may not be aware about what they have been prescribed with, but they are always aware about how they are treated, how the drug, after taking drug, how the patient is feeling. So this is what we are going to discuss, or we can measure in terms of humanistic outcome. So there are so many factors which is included in the humanistic concern, that the patient functional status should be measured. What is the ability of a patient to do the daily routine work, their daily course, how they are doing, what is their quality of life, mentally how they are feeling. They are not, they should not feel mentally tired, they should not feel physically tired. What is the satisfaction level of the patients? These all things are included in the humanistic outcome, and it is measured in terms of quality of life. So when we measure a quality of life, we get a actual idea about patient, how patient feels about the treatment provided. And if some error occurs, how this error is humanistically affecting the patient, what this error is affecting physically, mentally, socially, or we can say economically sometimes, because it is increasing the burden on the patient. Now, how can we measure the quality of life? So we can measure the quality of life directly from the asking the patient, or sometimes patient is not responding or patient is not conscious. It is recommended that we can ask the caretaker, or we can ask the near caretaker. Maybe in some hospital, relatives are not allowed if they are admitted into the ICU, so we can ask to the nurses that how they are doing in terms of quality of life, in terms of physical and mental well-being. So patient reported outcome can be measured, which gives very unique insights into how a therapy can affect a patient. This is very important. All the time, in a majority of the developing nation, the focus is less on patient satisfaction or patient feelings. The majority of the clinicians and healthcare professional are focused on patient came, it is a subject, it should be treated with the proper medication and should left the clinic. But no, it is also important that we connect with the patient and we ask them what is uh, their level of satisfaction, their level of concern related to the medication given. So patient reported outcome is very famous and important point to measure the humanistic outcome. Apart from that, health related quality of life is also important. So this can be done by using different questionnaires. So I have seen the question for madam session, that someone is asked that what are the questionnaires available to identify the error. But I would like to talk about the questionnaires which is widely used by so many researchers, where they use this questionnaire to understand the level of patient satisfaction related to the therapy. And if some error occurs, it leads to adverse drug reaction, which leads to adverse drug event. And this is how this is whole process is affected in terms of patient. So we ask patients some of the detail every day, they give us their input, and based on that input we can make sure that how the therapy was going in the particular patient from the beginning to the end. So definitely it should be the quality of life should be continuously increasing from the beginning. But sometimes because of this error, in between it fluctuates and goes down, and this is how we can measure that how what kind of error may occur. So we can also go retrospectively in this case, when the humanistic outcome we are measuring of a patient, and after some time we see there is no improvement in humanistic outcome. Maybe clinical data shows there is a improvement in outcome, but if there will be a problem in humanistic outcome, it gives an idea that something is going wrong. Some kind of error has occurred which was not noticed by the healthcare professional. So this is how it is important. Humanistic impact is very important also to track back to the medication error. I have literally did it in the oncology patient, as that is why I'm sharing my experience that humanistic outcome also help to identify the medication error. Different scales I have mentioned, not these are not the only scales, but I have just mentioned a few scales which you can use to measure the health related quality of life, to check what is the impact of medication error on humanistic outcome. So SF36, it is a questionnaire included of physical and mental questions. So how patient is doing, what about they can move or not, they can do self care or not, they can do proper work or not. This kind of questions are included in this questionnaire. Same thing, Eurocall group has also given EQ5D3L or 5D file instrument, where they have categorized that patient has a minor problem in doing housework, major problem, moderate problem. Likewise, they have given a questionnaire, and some disease specific questionnaire is also available. so that depending on the particular disease, the study you are doing or whatever monitoring you are doing, you can use these different questionnaires. So this questionnaires gives you some of the idea about how patient is feeling or how patient is doing with the therapy provided. Apart from that, humanistic concern. So very important point, to establish the role of clinical pharmacists in hospital is also economic outcomes. So if some hospital management asks that what clinical pharmacists are doing in the hospital, and a clinical pharmacist with a better understanding of a medication error and so many other activity of clinical pharmacists can show that prevention of medication error helps the hospital management in so many ways, not only management, also the patient. And this is how we can establish our importance in the hospital, in the our importance in the healthcare team. So this is how time for us to percolate in the healthcare system. So economic outcome is very important to show the benefit in terms of monetary perspective. And at the end, all is about what we are spending for the care we are receiving. So if we are spending more and not receiving appropriate care, there is a imbalance. So that can be corrected by providing optimal care and minimizing the healthcare expenditure. So economic outcome includes the measure of health resource utilization, how best the resources have been utilized to properly treat the patient. It includes three types of cost. This is very important point: direct, indirect, and intangible. Everyone are aware about direct medical cost and direct non-medical cost. Whatever medication charges, consultation charges, laboratory data charges, these are all comes under the direct medical and non-medical cost. But less focus is given to the indirect cost and intangibles. What are the indirect costs? So indirect cost is nothing but, we can say, if someone had admitted to the hospital for XYZ reason, he or she could not go to the job or respective work they're doing, and because of that particular time period they have to lose their payment, they are losing their wages. So this is indirectly because of the health, because of the abnormal consequences, their economic condition hamper. Apart from that, the traveling expenses from house to the hospital, and if someone wants to go to the very good consultant, maybe they are not present in the city, so they have to also go to the another state or city. So this is all included in the indirect cost. So if you calculate this also, the 42 billion US dollar per year will not be fascinating number. It is a realistic number if we consider indirect cost. And lastly, intangibles. Intangibles is all about humanistic impact. It is about the things which we cannot see. When someone had developed an adverse drug reaction, the suffering of patient, we cannot see that what patient is suffering from is considered as the intangibles. And so many researchers have put that suffering into a number, that this suffering is approximately equivalent to this much amount of money. So this is also included in economic outcome sometimes, that what are the intangible costs, what are the patients suffering mentally, physically, all are included in the economic outcome. Now this is the combination of humanistic and economic outcome, and this is the way we can use, or we can understand that how the health resources utilization and cost is combinedly affected. So utility and preference based measure. I already shared the questionnaire name in the previous slide. So that questionnaire will give you an utility index, one number it gives. At the end of all the questionnaire, we can summarize those questionnaire and we can give the numbers to that questionnaire based on the severity. We will get utility index, and that utility index, when multiplied with the duration of therapy, that is in number, how many days patient was there, how many days patient was in a good health, how many days patient was in a bad health. So utility index calculation will also give some of the idea. That utility index, when multiplied with the number of days patient lived in a good health, gives you quality of life, quality adjusted life years, not only quality of life but also length of quality of life. So If the number of quality added in some patient, it means patient is receiving good care, patient is receiving rational therapy, patient therapy is not having much of medication error, not having much of adverse drug reaction, and patient has gained several uh, good health in their number of years. Disability adjusted life years, same, whatever utility index, when we multiply with the number of days patient were in a bad health, will give you disability. Whatever disability time patient had, multiply with the utility index of that particular period, gives the disability adjusted life years. And this should be avoided. Quali should be added, but disability adjusted life year should be minimized, because we don't want to live in the disabled phase. We all want to live in a healthy phase. So this combination of humanistic concern with the economic concern, because this quali, when we talk about economic model in the next slide, incremental quali, incremental cost, this is very important for us to understand the quali. This may be difficult to understand for those who are the beginners in the farm D and B farm, but I just want to convey a simple message by this, by saying this, that whenever any kind of error occurs, it affects patient humanistically and economically, and these two combinedly measured by the quali as well as disability adjusted life years. This is the economic model, just for your understanding purpose, that how health outcome is measured based on the different scale. For example, uh, in one setup, we try to adapt a system where we try to minimize the medication error. That is called new interventions, that we have set up a specific department just to focus on medication error and prevention. And in one setup, we have not provided anything, or we have not set up that particular department to avoid the error. So this is a case control like study, where we can easily measure the patient quantity, quality, monetary value, and the benefit in terms of health outcome. And we can measure resource utilization in terms of cost. What are the cost behind the treatment of that particular patient? And when compared, it gives an idea that in case of medication error prevention department, or a specific dedicated clinical pharmacist appointed to avoid clinical medication error, overall outcome improves and the cost will reduce. So this is how it is evaluated in terms of a hospital setup, to show the importance of clinical services inside the hospital setting. And these are the different health economics model. We don't have to go into much detail into this, because this is a little bit difficult for the students to understand. But just I want to convey that once you calculate the quality, or you calculate the quality, health related quality of life, and also have a cost of a therapy of a particular patient, combine it and use the model to explain that by little bit change in the therapy, or little bit improvement in the hospital setup, in terms of recruiting clinical pharmacists and paying them, there will be a huge benefit achievable. These models are for them. So whenever we talk about medication error related humanistic and economic impact also should be considered. I have just kept these two studies for the understanding purpose, where in 2012 and 2016 few researchers have done a study. It is a type of retrospective study. One is case control and one is comparative study. Just try to understand that out of 2100, they have identified 190 medication error in hospital setup, and they have categorized into preventable adverse drug event, with harm and without harm. So if you see the number, the medication one specifically error when occurs, it is increasing up to $6,000 cost in the average hospitalization. So the impact of this medication error and the increasing in the cost of hospitalization is very huge. Apart from that, it is increasing the hospital stay on an average by 4 to 5 days. So error occurs, it leads to increase in the hospital stay for 5 days. Definitely that 5 days will be considered and the cost behind it, it will lead to definitely $6,000 to $7,000 per one error. So this is how this medication error is affecting, and this is the study in 2012 and 2016. I'm not talking about long back. I'm talking about this recent, and this are the study centers are developed nation in US, in Netherlands, where the system is very much sophisticated, very much smooth, and they have all much trained healthcare professionals. So the purpose is that medication error can occur at any time, even today, even in future. But as I said in the beginning, sir also mentioned very much and very precisely that it should be prevented from reaching to the patient. The second study is the sample size is very huge, 57,554, 470 error were identified, and they have classified the error in terms of error of ordering, transcription, dispensing, administration, and they found that it is affected very much economically to the patient. And when we talk about the patient expenditure, we also have to consider that this is our healthcare expenditure. It is affecting the nation at large. So this is very important for us to understand that medication error not only looks small, looks very reluctant, that all the time we are discussing about look-alike, sounded like drug or something like wrong labeling, but medication error has a huge impact humanistically and economically, should not be neglected. There are so many research required in this field where we can actually come up with the exact cause of the medication error and their impact, so that we can still develop a preventive strategies. At the end, in conclusion, this is my own perception that medication error are definitely preventable. We can obviously prevent any error to reach to the patient by making sure that everyone works in a very smooth way, and in a very we can say developing and skill, so that we can train them periodically to avoid this kind of error. Because in our field, the knowledge should be updated each and every day, skill should be acquired at very frequent time period, so we can definitely prevent the medication error. And prevention of this medication error have a very positive impact clinically, humanistically, and economically on when we talk about a patient. Definitely three types of benefit patient will get, and definitely a healthcare practitioner will also get some recognition. And the key to avoid this medication error is for clinical pharmacists adopted in all the hospital settings, so that they can prevent medication error. Indirectly, they will preventing the adverse drug reaction, irrational use of medications, and medication some disastrous adverse drug events. So this is how I would like to say that we have to look into a bigger picture, that medication error not only occurs in terms of a small gesture, but it is also have a very huge impact humanistically when it comes to patient suffering, feeling about how they are treated, how the treatment is affecting their quality of life, and also their pocket economically. So this is all from my side. Uh, if you have any doubt, definitely, because of time constraint, if maybe someone doesn't have time to post their query, you can email me. This is my contact details. I would be very happy to answer your queries. So this is all from my side. Tani
Sir,
ma'am?
there is a query from our delegate, sir.
Definitely, yeah.
Sir, can you see it, sir?
Yes. Is the CDC health related quality of life instrument free, and are there any copyright restricted, sir? So, very good question. I would like to say the name is Jabili. Okay. So, yeah, definitely there are so many questionnaire available which are free, but the problem is you have to seek consent from them. So you have to email them that this is my study protocol, and I want to use this questionnaire for this research purpose, and not for any other kind of interest. Then they will provide you the certification, or they will provide you the letter which says that you can use this questionnaire in your setup after validating it. So you have to take approval from the CDC, and then you use this question array. But before using that, you have to validate it in your setup. You have to send those validated data to them, and then you can use it for publication as well as for your study purpose. So this is the complete procedure. This is how you can seek the approval. I hope I made the clear answer. If you have still any doubt, you can email me in my contact details.
Thank you so much, sir, for giving us insights on humanistic and economic impact of medication errors. Thank you for being a part of this webinar, sir.
Thank you, Dharni ma'am. I would like to also say thank to the St. Peter Institute staff. You are very much humble, and I am very much grateful to join with you. It is a pleasure. Thank you so much, audience, for your kind patience and listening. I hope I made my topic very clear to you. And I would also like to thank, last but not the least, to all the organizer, Dharani ma'am, for the continuous support and whatever insights of this webinar. And lastly, to all my friends and colleagues, specifically Manushri. She is my very good friend. So I would like to thank you also for this opportunity. Thank you so much, ma'am.
Thank you. Now I request Dr. D. Praveen, Head of the Department of Pharmacy Practice, to deliver the oath of thanks.
Very good afternoon, everyone. And this was another wonderful webinar we had regarding medication errors. So I would like to thank our Honorable Chairman, Shri T. Jayapal Reddy sir, for his constant guidance for organizing such webinars. And I would also like to thank our principal, Dr. P. Rajshekhar, for his constant source of support. This webinar wouldn't have been successful without our speakers, Professor Dr. P. K. Lakshmi, Professor and Head Department of Pharmacy Practice, G. Pullareddy College of Pharmacy, and Dr. K. Santosh Kumar, Assistant Professor, AU College of Pharmaceutical Sciences. Dr. Avinash D. Kadela, Assistant Professor, Department of Pharmacy Practice, Pukat Asadya University. I would also like to thank the convener, Dr. Dharani, and the organizing committee members, Dr. P. Ranadir Chaudhary and Ms. Shivani Raula. I also like to thank all the teaching and non-teaching staff of St. Peter's Institute of Pharmaceutical Sciences and all our delegates who have registered in large numbers and attended the session. Thank you very much, and we would like to meet you in another wonderful session. Thank you.
Now it's time to end the session. I thank all the delegates for their enthusiastic participation. I hope it is very helpful and have gained some informative knowledge from this webinar. We will meet you in very soon for the next webinar. Thank you one and all.